Good morning, commissioners.
Good morning, Ms. Beck.
Morning.
Morning.
Are you all distanced except for Commissioner Rippon, or are you all here at the courthouse?
You got 2 out of 3.
Out of 3. It's cold.
Kind of like a Meatloaf song.
It does. It really does. It's cold in my office this morning. So, and my office, yeah, I've told you before, my office is traditionally cold, and they say it's, part of it's my personality, but part of it's because I just, it just happens. But so I have the heater on for Stephanie. I don't want her to freeze her out during the course of the meeting. And of course, I won't be staying for the health board meeting. So I'm assuming
We are going to have an executive session between the Board of County Commissioners and the Board of Health. So we'll come back from executive before we go into Board of Health. And
then you'll just go into okay. So like I said, I'm assuming whoever is on the health, I don't know if they actually have an agenda, but for
there is a brief one, but yes. And so
they'll take it over, take over doing that, because I won't be on the Zoom meeting after when that starts. Okay.
That's correct.
Right. Oh. Can't believe January's almost over with already. We got corrections. We do. Okay.
Okay, I believe it's 9 o'clock. Is that correct, Ms. Beck?
Yes, sir.
Okay. Good morning. Welcome to the last meeting in January for 2021. It's gone by pretty quickly so far. This is the Shawnee County Board of County Commissioners. My name is Kevin Cook. I serve as the chair of the Shawnee County Commission representing District 2. Joining me today is Commissioner Bill Ripperon representing District 1 and Commissioner Aaron Mays representing District 3. Good morning, gentlemen. We are meeting in a remote environment by video due to the COVID-19 pandemic. We are hopeful that we can return to in-person as soon as we are able to. And if you do wish to address the commission on any item or during administrative communication, please do contact the Shawnee County Commission to sign up to be able to address the commission. We will begin with the Pledge of Allegiance. If everyone might mute your mics, and then we all recite the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Madam Clerk, our first item.
Okay, our first item is item 1, proclamation presentations. Presentation by Vallejo's quarterly report. Bill Persinger, CEO. Morning, Bill.
Morning, commissioners and everyone there. Thank you for the honor of signing on. The first thing I want to do is say thank you to Stephanie Kuhlman. She helped this old dinosaur get signed up and figure out how to share my screen on Zoom. So thank you to the wonderful staff there, including Stephanie. And I believe we've probably got Dick Klein with us this morning, who's our former chair. I'm not sure that Sergeant Josh Clam, our current newly elected board president, is with us, but I did want to notify you that Josh is now chair of the Vallejo board, and there may be some other Vallejo board members listening in on YouTube, but we're honored to be here this morning. I want to say again, thank you to the commission for the funding increase this year. I want to report that all levels of government, from the city up through the federal government, have chipped in and helped out not only Vallejo, but mental health here in the state of Kansas during our pandemic. And we are so grateful. I want to say thank you to the health department for the great job they're doing at their mass vac clinic over at the Ag Hall. Went through there yesterday. It was smooth, and very much appreciated Dr. Cooley and Craig and others at the health department for the work they're doing. We've also want to say thank you. A number of our local foundations and charities and grant making sources have stepped up to help Vallejo as well. And we just couldn't be more grateful to feel that kind of validation during some pretty tough times. I want to see if I can share my screen now. This might be the hard part. Stephanie's on backup in case I goof it up. Let's see.
Bill, I have faith in you.
Yeah, I'm gonna try here. I think, did it pop up?
It did.
Super. Commissioners, I'll run through here as quickly as I can, but holler and stop me anytime. And of course, if you have questions, y'all have my cell phone number, just reach out anytime. And so I just want to give you a quick picture of Vallejo today as regards COVID-19. We have just 1 or 2 staff right now who have tested positive and are at home and getting better. And then we have several on voluntary quarantine, but pretty lucky so far, taking an abundance of caution like everybody else, a UVC cleaning device and deep cleaning and lots of staff education. Our medical director, Dr. Seidlinger, is trained not only in primary care, but mental health, and she gives us great guidance. We're just doing everything we can to keep clients and staff and our occasional guests safe and healthy. And all the programs are opening. Some are operating at limited capacity. Deep Detox is open full bore, but the inpatient treatment program and some of our residential programs are running at about half speed, just so we can put one person to a room, instead of instead of 2 to keep the virus at bay. But we're still here, still doing our jobs. And again, thanks to you guys, we're able to do that. Our financial report should be attached. It's an unaudited version as of 12/31/2020. And you know, you take everything into account. We kind of broke even last year thanks to the the Paycheck Protection Program. Alan Tao and the folks there at Fidelity Bank were just awesome. That and the grant funding we received just really saved us last year and helped us enter this year in stronger. We're a little concerned, you know, what the spring and summer is going to bring when some of those grant dollars begin to, go away or shrink in some way. But we're always hopeful for the future, and you know, that's the one word I would take from last year is hope. And you all were part of giving us hope. We do appreciate that. Let's see. I'm just going to glance here. Put my reading glasses on. Oh, did want to focus on, you know, the other agencies we're working with locally, United Way and Rescue Mission, Topeka Community Foundation. I hate to list names of organizations because I always leave somebody out, but just, you know, last year and going into this year just brought so many opportunities to strengthen some existing partnerships and make some new friends. And, you know, we just get some things done together. And I'm going to scroll on down if you don't mind. Oh, there's our list of our board members, and I'll come back to that real quickly. There's the financial report. We did get a state grant along with some other mental health centers in what were called some hot spots. 7 or 8 months ago, 6 months ago, there were 7 or 8 counties that, you know, had quite a bit of virus going on, and the state of Kansas provided those counties with some funds to do a crisis counseling program. This is a free service for folks, and just a little information about that right there. The Kansas Crisis Counseling Program for COVID-19, of which Vallejo, Wichita, Kansas City, a few other counties, some rural, some urban, are participating. And then the Warm Line grew out of a discussion last year with the mayor, and it ran its course and did a good job. And then we were talking late last fall with the United Way and 30 or 40 partners, and somebody said, well, let's maybe get the Warm Line going again. So this time, instead of people calling a Warm Line, we've set up a Shawnee County Warm Line where we will call you. And I say we, there are a number of partners involved, Topeka Volunteers.org and through the United Way. And we've got trained and vetted volunteers who can call folks to see how they're doing, people who may have, you know, limited contacts on the outside or people with special needs, that kind of thing. So if an individual is being served by an organization and they want a referral to the Warm Line gets your name and number. We call you just to see how you're doing. And so that program is underway. Another great program, if you'll pardon me for scrolling back up here, that we're engaged in and is called Operation Clean and Healthy. It's a platform that was built in Arkansas, should be arriving fairly soon. That is a mobile shower, bathroom, and laundry facility. We received a grant from the Kansas Housing Resources Corporation here in Topeka, not only for that, but some vouchers, some housing vouchers. And our partners, the Rescue Mission and several area churches, will sponsor this mobile shower, laundry, and bathroom facility for people who are unsheltered or other people who are at risk. And thanks to some food partners, there will be food available to people when they come to the mobile shower facility called Operation Clean and Healthy, and there'll be other services there that they can access. So really kind of a rolling one-stop shop for some of our most vulnerable citizens. So I did want to point that. Don't have a flyer for that yet. We're working on that, but there's just a few paragraphs on our partnerships and our collaborations. Some things we're working on, as always, are we want to keep our state grant increases going and even increase those some more if we can to get us caught up with kind of current dollars and current expenses. Our Medicaid rates are always a concern. Medicaid expansion is still a target. Increasing the number of beds available at the state hospitals. The local legal system has been very supportive with that, as have our hospitals, in taking care of folks who have a severe mental illness crisis, and just a workforce and some other things. You know, the other thing that really saved us last year was the Department of Health and Environment and the Kansas Department for Aging and Disability, who got together and approved the use of telephone and televideo for Medicaid reimbursements, so we could deliver those cares and get services and get paid by Medicaid. It really did save us. One of those things that saved us last year, and frankly saved our consumers as well, many of whom don't have access to televideo because they don't have connectivity. So some of them do have cell phones. Where they didn't, we were able to provide some to them. And then just also want to say thank you to DA Kagay and Judge Parrish and others. We've formed what we're calling the Intersection Coalition. That would be the intersection between the legal system, all parts of the legal and correctional and law enforcement system, coming together to look at how that intersects with behavioral health care. There's a report that's out. I think I've got a reference to a copy of it here on down the scroll. But we do have a group working in Shawnee County to make sure that we're prepared for changes in criminal justice that are coming along, not only in mental health and addictions, but sentencing guidelines and, you know, matters of racial and other kinds of equality matters. So if you haven't read that report, you get a chance to take a look at it. It's great. I have included a synopsis of it here, I believe. There's a list of our board members for 2021. We have a full board now, well represented from all parts of the community. And in fact, we were just notified we got our license as a mental health center was renewed for 2 years, which is pretty good finding. Again, there's the financial report, a couple of flyers we have for you. There's the report of the Criminal Justice Reform Commission. It is, you can find this piece in the first 8 or 10 pages. Please consider that kind of an executive report. I do serve on that commission. And we hope to continue serving the legislature for another year or two. Commissioners, I'm sure I've forgotten to point out something, but I'll stop there and take your questions, or if you have concerns, I'll be glad to address those. And again, thank you for the time, and thanks to Stephanie.
Bill, this is proof that if you're able to get on and share your screen and go through a presentation, anyone can. So
exactly right. Commissioner, I did forget to mention we continue our data study on the co-responder program that we have, where we put a mental health person out on the street with our local law enforcement, both the Topeka and the TPD and the Sheriff's Department. And we diverted quite a number of people from jail last year, saving hundreds of, let me say, scores of thousands of dollars and in jail time that's avoided. And we've been working very closely with Director Cole on that. And so I might also mention in that vein real quickly, and then I'll pull back. We're looking at a program called Stepping Up. And so if you hear Director Cole or DA Kagay or others talk about stepping up, we're in the exploration stages. That's part of what our Intersection Coalition is working at. And so if you hear more and see more about that, please know that we're gathering information to present to you in the near term. So with that, I'll pull back and say thank you again.
Commissioner Mays, do you have any questions for Mr. Persinger?
I do. I have two questions.
Sure.
The first one is in regards to the warm line.
Yes, sir.
If somebody's feeling maybe reluctant to call that line, can you assure them that their information they share would be subject to HIPAA privacy and confidentiality and things like that?
That's true. Whether they call in or whether they get a call, Commissioner, each of the organizations participating have their own rules about privacy. And so what they would do, for example, if it was a Vallejo client that we thought maybe needed some extra support, a phone call a couple times a week, just, from a friendly voice, we would get that person's consent, and then we would provide their name and their phone number, and that's it, to the folks at the call center, which is being managed by a local mental health nonprofit here called Healthsource. It's a nonprofit headed up by Casey Johnson, a new arrival here in Shawnee County, our chief executive. Healthsource is owned and operated by all the mental health centers across the state, us, Family Service and Guidance, and others. It's a nonprofit, and they do contract work on behalf of the mental health center. So I called KC and said, hey, we've got an idea for a program. Can you handle the phone bank? Can you handle the technical piece of it and help with the volunteers and all this and all that? And they stepped right up at their expense, by the way. Did step up and helped out as a community partner. But yes, Commissioner, people would give their consent to receive a phone call from a volunteer, and then minimal, if no information, would be provided to the caller except the individual's name and number. So, you know, if you know, one of the CDDOs or the rescue mission or harvesters or someone wanted to refer somebody, they would get that individual's consent and then provide the name and number, and then that person would get a phone call. And so we hope to continue to report on that with favorable results, but it's something we can do ongoing, just a little extra help for folks during these, you know, really unusual times.
Yeah, my second question is in regards to the Operation Clean and Healthy.
Yes, sir.
It sounds like a program that's got the potential to be pretty impactful in our community. If folks are wanting to get involved through donations of toiletries and things like that, is that a need that you have? And how might somebody go about doing that?
You bet. Cleaning supplies, food, other assets. I will say again, you know, we're doing the point in time count. You know, Vallejo and others, the rescue mission, got folks out, you know, taking an assessment of our unsheltered homeless. Socks are always needed. So if people want to donate, you know, let me at this point say that they can contact me, and I'll just go ahead and shout out my email here at work. It's B, which is short for Bill, Persinger, PERSINGER at Vallejo, Topeka.org. And just say, hey, Bill, we have some donations for your program. What do we do? And I'll direct them to the right person. But yeah, you betcha, we would sure accept some help with that, Commissioner, as would the rescue mission. And I don't have a list of the 4, 5, or 6 area churches that are gonna allow this platform to be parked and then drain into their sewer system, and we'll use their parking lots, and we'll have to drain the black and the gray water, of course. But kudos to the churches that have stepped up. And as soon as I can, I'll provide you with a list of those churches.
And can you remind us again when you anticipate that program being up and running?
Sure hope the platform gets here yet this month. I know it's late in the month. We're hoping sometime in February, Commissioner.
Great, thank you.
Thank you for the questions. Great questions.
Commissioner Rippon, do you have any questions? And you're muted. Commissioner Rippon, you're still muted.
There we go.
There you are.
Bill, have we seen a surge in clients there, and are you working at capacity, or are you? I just want to know what the stream was like there at this point.
Well, you know, things are running about the same as in terms of the number of people seeking services, and I've heard several other agencies say the same thing. What we have seen is an increase in the acuity or the severity of problems. So the problems that our unsheltered folks are having, the people who are coming in with addictions to detox, folks walking into the mental health crisis unit have just some extra serious problems going on. And, you know, at a time, you know, when we've had staff out on quarantine and have had to reduce the number of beds available, it's been pretty tough. And like I say, we couldn't have gotten by without the extra help from a government and our other nonprofit grant makers. But yeah, the increase we've seen is just sort of the pressure, if you will, of people having, you know, kind of extra severe situations. At one point, and I haven't looked at the data for 10 days or so, but the number of services rendered, not the number of people, that's been pretty steady throughout the, there was a dip there in March and April when people just didn't go anywhere. But the number of people seeking services is about the same, but the amount of care that we've been able to deliver, that had spiked here a few weeks ago, even above pre-pandemic levels. So I was glad to see that the volume of care had gotten back up to where it was. But things have been fairly steady, Commissioner, except for the severity of the problems we're seeing.
Thank you.
Bill, along that same line, in June, we were talking about Vallejo had to make some cuts to some programs and services due to COVID and in the funding. Where do we stand with those? Are we back up to speed where we were in March of last year, or are we still working to try to get back up to that point?
Now we're up to speed, and we didn't have to follow through with a lot of those. The city came through with funding for CIT, the PPP loan came through. We had the state came up with a couple of grants that we weren't anticipating, and so while we had trimmed back for a while here and there, and avoided laying people off, we were able to keep running at steam. Things were pretty, we just didn't know kind of where we were at in the spring and the summer with, funding that was coming, but the state came through with the crisis funding, and, I could just, the list just goes on. And so it was a little bit scary there for a while, what we might have to do. So we didn't have to enact a contingency plan.
Very good. I'm glad to hear that. Dick, I just want to thank you for your time and service, and I noticed that you're here, and also Officer Clam, I noticed that you're here, and so you're going to have a big role to fill as the new chair, and so thank you for your service.
Absolutely, sir. Thank you very much.
Yeah. Well, Bill, I don't know that I have anything else, but thank you very much for all that Vallejo does in the community, and continuing to enhance our mental health for Shawnee County and Topeka.
Thank you, commissioners and staff. We sure do appreciate it, and we'll just continue to carry on.
Yeah,
Thank you.
thank you.
Thank you very much, Bill.
Bet.
Ms. Madam Clerk, our next item.
Item 3, consent agenda.
There are 4 items on the consent agenda. Is there a motion or questions?
I would move that we approve the consent agenda.
I'll second.
Motion made by Commissioner Rippon, second by Commissioner Mays. Roll call vote, please.
Cook,
Yes.
Mays,
Yes.
Rippon,
Yes.
Show that it is approved 3-0. Our next item.
Item 4, new business A, County Clerk number 1, consider all voucher payments.
Commissioners, today's voucher report totals $761,397.30. Highlights of that report are under building maintenance, 2 items, one for AFCO LLC for $43,194. That's for the Country Club playground equipment, Country Club Park, I should say. Then Cine and Company totaling $31,697.80. That's for the final payment on the Hillcrest Community Center remodel. Under community corrections, we've got Heartland Regional Alcohol totaling $49,983. That's for services for drug and alcohol risk assessments and treatment. And then under state grant, we have pass-through funds for Kansas Children's Service League in the amount of $99,622. And then also for the Topeka Center for Peace and Justice, that's for $30,474.73. And I don't have any questions about those, so I would move for approval.
I'll second. Motion made by Commissioner Mays, second by Commissioner Cook. Our roll call vote, please.
Cook,
Yes.
Mays,
Yes.
Rippon.
Yes.
Show that is approved 3-0. Our next item.
Item A2, consider correction orders.
I'll move for approval.
Second.
Motion made by Commissioner Cook, second by Commissioner Rippon. Roll call vote.
Cook,
Yes.
Mays,
Yes.
Rippon.
Yes.
And that is approved 3-0. Our next item.
Item B, information technology number 1, consider authorization and execution of contract C44-2021, reference contract C17-2020 with Optiv for the renewal of annual firewall maintenance to include upgrades at a cost of $63,244.33 with funding from the Information Technology 2021 budget.
Good morning, Commissioners. Pat Oblander with the Information Technology Department. As mentioned, this is the annual renewal for the maintenance on all of our firewall software and hardware components, a primary layer of defense for our network and protecting all of our data and resources within Shawnee County. If you have any questions, I'd be happy to answer those.
Any questions for Pat regarding this item?
None from me. I'll move to approve.
Second.
Motion to approve by Commissioner Mays, second by Commissioner Rippon. A roll call vote.
Cook,
Yes,
Mays,
Yes.
Rippon,
Yes.
so that is approved 3-0. Thank you very much, Pat.
Thank you, Commissioners.
Our next item.
Item C, Public Works, number 1, consider awarding bid to Potter Industries LLC for up to 44,000 pounds of glass beads in support of road maintenance operations in the amount of 0.378 cents per pound, including delivery for use in 2021, with funding dependent upon the specific location of use from the road maintenance funds of Public Works and Monmouth Township.
Good morning, Commissioners. Kurt Niehaus, Director of Public Works. This is our annual bid for glass beads. Obviously, as I've talked about in the past, these glass beads provide retro reflectivity for pavement markings. We received 2 bids. The best bid was provided by Potters Industries, Valley Forge, PA. This best bid, lowest best bid, met the specifications, so Public Works recommends its approval. Questions?
Where does this relate to last year? Are we seeing the price increase or stay really kind of stable?
Well, for glass beads, it was pretty stable. We had less than a 1 cent increase, a 1 cent per pound increase over last year. So for this glass bead product, it appears to be stable, at least for this year.
Any other questions for Kurt regarding this item?
Kurt, just out of curiosity, how much is 44,000 pounds of glass beads? Is that like a truckload? Is that, I mean, like,
You know, Commissioner Mays, I'm not certain what the volume would be.
Okay.
That's a good question. I guess that would be like a test question, but
It's irrelevant to the approval of this agenda item. I just, out of curiosity, thought it might be interesting to hear. So.
I would have to do a little research and brush up on my math, but if you want an answer, I can sure get it for you.
No, it's all right.
I'll
move to approve. I'll move
Motion to approve by Commissioner Mays,
Second.
second by Commissioner Rippon. A roll call vote, please.
Cook,
Yes,
Mays,
Yes.
Rippon,
Yes.
so that it passes 3-0. Next item.
Item C2, consider awarding bids to BuildX LLC for up to 5,000 cubic yards of expanded shale lightweight aggregate to support of road maintenance operations in the amount of $59 per cubic yard, including delivery, for use in 2021 with funding depending upon the specific location of use from the road maintenance funds of Public Works and Grove Township.
Kurt Niehaus, Director of Public Works. Similar to the last item, this is an annual request. It's for lightweight aggregate, also known as haydite. This product is used in chip seals, and the reason Shawnee County likes this product is because of its lightweight nature. We get less claims for broken windshields. It provides good friction for between tires and the roadway surface. And this year, like previous years, we received 1 bid from BuildX. And the reason we typically receive 1 bid is because, quite frankly, there's only 1 manufacturer of this type of product in the area. Nevertheless, the bid met the specifications. I feel the bid unit cost is competitive, and so Public Works is recommending approval. As before, I look forward to your questions.
Any questions regarding this item? I'll move for approval.
I will add that to Kevin that it represents an increase of $1.30 per cubic yard over last year.
Thank you for that. Motion to approve by Commissioner Cook. Is there a second?
Second.
Second by Commissioner Rippon. Our roll call vote.
Cook,
Yes?
Mays,
Yes.
Rippon,
Yes.
Show that it passes 3-0. Our next item.
Item C3, consider authorization and execution of contract C45-2021 with Ham Inc. for improvements to Southeast 45th Street from just west of the intersection with West Edge Barrington Road to just east of the intersection of East Edge Road at a cost of $4,486,525.53 with funding from a variety of sources covering multiple years.
Courtney House, Director of Public Works. On Wednesday, January 13th, we had a bid letting for our Southeast 45th Street project. We've talked about this project for a number of years. In fact, the commission approved the project budget all the way back on October 10th of 2019. Fortunately, we received 4 excellent bids. 3 of those 4 bids were very close together in price. And the lowest bid, as the county clerk indicated, was submitted by Ham Incorporated for approximately $4.5 million. Now, to put this in perspective, on October 10th of 2019, when you approved the project budget, that approval was for approximately $1.4 million more than the low bid amount. But please be aware that included design costs, utility relocation, right-of-way acquisition. So this bid from Ham, very competitive. It fits in with our project budget. We're very pleased with it, and we do recommend its approval. If you would like an update, a brief update on the scope of the project, I can sure provide that, but otherwise I look forward to your questions.
Questions for Kurt regarding this project or the award?
Kurt, were there any add alternates to this project or anything that we may have not included in this project that if we come in under budget, maybe we could pick up as part of this project?
There were no add alternates. From a Bill, knowing your background, you're probably thinking about maybe a park setting. Just a reminder, we are improving the trail there at the south end of the lake. The bridge, the girder bridge that replaces a stone arch bridge, we're going to provide the same architectural treatments that we did on the Southeast 29th Street Bridge. So I think when the project's complete, it will fit in with the environment. It'll be a wonderful improvement. And I think the Parks and Rec people will even be pleased with the results.
Very good.
Kurt, I know we've mentioned this before, but I just want to reiterate it one more time. How much I appreciate the variety of funding and creativity when it comes to paying for these projects without bonding. And so I think that's great. I also think that when I look at these bids, how close they are, I feel very confident that we got an excellent price and a fair price on this. So thank you.
You bet. And I concur with your assessment.
Is there a motion regarding this item?
I will move to approve.
I'll second.
Motion made by Commissioner Rippon, second by Commissioner Mays. Our roll call vote.
Cook,
Yes?
Mays,
Yes.
Rippon,
Yes.
So that it passes 3-0. Thank you very much, Kurt. And I'm sure we are all looking forward to finding out how much space the glass beads can consume.
Thank you.
Our next item.
Item D, Health Department, number 1, consider authorization and execution of contract C46-2021 with Aaron Locke, MD, to be compensated $125 per hour, up to $80 per month for professional medical and health services as required of the local health officer of Shawnee County, utilizing COVID-19 grant funding and health department tax allocations.
Good morning, Commissioners. Craig Barnes, Health Department. The item you have in front of you today is the agreement to have Dr. Aaron Locke start as our health officer next week on Monday, February 1st. As mentioned, this contract is for, we'll have compensation in the terms of $125 per hour for up to 80 hours per month. We are extremely excited about the potential of having Dr. Aaron Locke as our health officer. She does have her master's in public health from the University of Kansas, as well as her MD from there as well. And I think during our interview process, she already portrayed some knowledge. She serves as the liaison officer for the COVID-19 response for the Holton Community Hospital, where she is currently employed. And so she brings that knowledge for the COVID-19 response to Shawnee County as well. And so we are excited with your approval to welcome Dr. Locke on board starting next week. I would be happy to answer any questions you may have.
Before we hear from Dr. Locke, are there any questions for Craig? Okay. Doctor, I see you here. There you are. Would you mind maybe introducing yourself, give a little bit of your background?
Yes, absolutely. Thank you for inviting me today. I grew up in northwestern Kansas, and then I went to undergrad at Notre Dame. I came back for my medical and MPH degree, as Craig already shared. It was a combined 5-year dual degree. I completed my family medicine residency in Tacoma, Washington, where I was the chief resident. And then I came back and have been working at Holton Community Hospital doing broad spectrum medicine. I have also served on the chief of staff for our at Holton, participated in the health assessment for the county and the health improvement plan, and was also actually a deputy coroner for the county. So I'm very excited to join everyone in Shawnee in this effort.
Well, we're very excited to have you here and very pleased to have you sign on. But would you mind maybe in kind of talking about, as a resident of Shawnee County, what some of the things that you see moving forward as a health officer? What would your kind of role be, and what are some of your priorities?
Absolutely. In these next months, of course, COVID is going to be the priority. As far as my role goes, I'm really looking to build relationship, get to know everyone, really strengthen the relationship between the commissioners and the health department, and be that liaison there, as well as with the hospitals and other healthcare providers. The vaccine rollout is going to be priority number 2 for me, which will compete with priority number 1, of course, because we all want to get this vaccine in arms and get our community safe. As we look towards the future, we'll need to really reassess the health status in Shawnee County. The evaluations that were done before the pandemic will likely look very different after the pandemic. And so we'll need to really reassess where are we, and then set the priorities for moving forward.
Commissioners, any questions for Dr. Locke?
I'd just like to say welcome aboard, and we're anxious to get you going here at our health department. So
thank you. I am anxious as well.
Yeah, I'll reiterate that. Thank you so much for coming here today and kind of sharing a little bit about your background. And we appreciate you joining our team, and we're excited to get you started in that role.
Thank you.
I would like it noted that when we interviewed Dr. Locke, we asked several times, are you sure you know what you're signing on for? So, in a week or two or in 30 minutes, just remember, we asked if you knew what you were signing on to.
You did. Yeah, I really appreciated our conversation. I thought it was excellent. I'm going in eyes wide open. And I think that it's everyone's duty to step up where they can step up. And so that's the idea I'm taking into my job.
Before we move for any official action, I know that we have Teresa Fisher with us this morning. I don't know, Teresa, if you're able to participate, but any comments or any statements as the interim health director?
Good morning, commissioners, and good morning, Dr. Locke. No, I would just echo Craig's sentiments that during our our brief time to get to meet Dr. Locke, we were impressed just with the variety of background that she brings and the public health experience. So we feel like she has many attributes that are really valuable as a health officer, and does have an understanding of what specifically we're looking for in a health officer, and is ready to take on the challenge of that. So we're excited to bring her on board and know that she'll hit the ground running.
Well, we look forward to everything that moving forward. So is there any other discussion, questions, or motion?
I'll move to approve. I'll take a second then. I'll do the second.
Motion made by Commissioner Rippon and second by Commissioner Mays. Our roll call vote, please.
Cook,
Yes.
Mays,
Yes.
Rippon,
Yes.
Congratulations, Dr. Locke, and we look forward to having you here as our health officer. And I think that the only person more excited about this is probably Dr. Cooley. So, thank you. Our next item.
Item 5, administrative communications.
This is an opportunity for the public or any department head to address the commission on any item. Is there anybody who would like to address the commission at this time? Going once, going twice. Commissioner Rippon, what news do you have for us?
You know, I come here with very little news today. I really haven't been out much this week, so I have nothing to report.
Great. Commissioner Mays.
Nothing from me. I know we've got an executive session, and then we'll be coming back, if I'm not mistaken, for a Board of Health meeting. So we'll look forward to that.
And that is correct. We will have an executive session today. And following the executive session, we will be having a Shawnee County Board of Health, where we will be discussing and reviewing the status of health and COVID in Shawnee County, as well as the current health order and where we stand. But before we go into the executive session, with the changing cooling weather, please do be weather aware. Make sure you have a packet in your car. This is kind of reiterating some of those things we hear from emergency management, is always be prepared and make sure that if something were to happen and you have a snowstorm or whatnot, that you are prepared. So, Madam Clerk, our next item.
Item 6, executive session.
There is a need to go into an executive session for not to exceed 30 minutes for the following reasons. 1, to discuss personnel matters of non-elected personnel, specifically to discuss contract negotiations with AFSCME, 15 minutes. 2, for the preliminary discussion of the acquisition of real property for 15 minutes. And 3, for the consultation with an attorney for the public body or agency, which would be deemed privileged in the attorney-client relationship. And those were the same issues. We will be joined with our county counselor, Betty Greiner, and Angela Lewis, our HR director. No action is anticipated on these items at this time. And this is a motion made. Is there a second?
Second.
Show motion made by Commissioner Cook, second by Commissioner Rippon. Roll call vote.
Cook,
Yes.
Mays,
Yes.
Rippon,
Yes.
Show that it passes 3-0. We are in executive session for 30 minutes.
are you going in at 9:44, sir?
Let's say 9:45. Just roll me up 1 minute.
All right, thank you.
Hello?
I'm back on.
Are you?
I just started the,
Executive session?
no, the executive session's
It's
over.
over? Okay.
We're back going into the
Oh, we are?
commission. Yeah.
Okay. I thought it was a little
Still? Did you get any sleep?
Okay. We are got technically 30 seconds or so, but Ms. Beck, if you say when we can come back and we'll get started.
You're fine.
All right. We are back from executive session. No action was taken. The Shawnee County Board of County Commissioner meetings is now adjourned. And we will be now going into the Shawnee County Board of Health. Ms. Beck, have a good weekend.
You too.
Okay. This time I would call together the Shawnee County Board of Health. And if we could, I'm going to turn the platform over to Teresa Fisher if you want to kind of get us started.
Good morning, Commissioners. Teresa Fisher, Interim Director at the Health Department. So today we do have an agenda of some items that we would like to put forth and discuss. We are going to open up with today by going over the scorecard release. And with that, I'm going to have Craig Barnes take us through the scorecard.
Good morning, Commissioners. Craig Barnes. I am the Operations Section Chief for our COVID-19 response here in Shawnee County. I'm going to go ahead and share my screen with the scorecard breakdown for the last week's reporting period. So as you see here, here's the breakdown of the scorecard that we released to the public. It will be released most likely during this Board of Health meeting on our social media platforms and to the public at large. So with that, what you'll see here is that the scorecard itself has decreased again, this time from 19 to 17. So just keeping us within that uncontrolled summary index. So we're still seeing some encouraging trends here. Most measures, however, though, are still in the red uncontrolled area, as you can see here. We saw another decrease in cases for the weekly case incidence from 19.7%, so to the 604 that you're seeing there in the top box. This
Greg,
is now, yes, sir.
If you could, and again, kind of walk us through, as we're looking at this, this 604, where do you draw that number from?
Yeah, so the number that we pull for the weekly case incidences come from the cases as they are by the date diagnosed. So we receive all of those, all that data directly from KDHE. They update those numbers Monday, Wednesday, and Friday, and they're available on their dashboard. We do provide a link to all of the figures that we use to make the scorecard in the scorecard, and a specific breakdown of where each of those numbers comes from for each of the indicators is also located in the scorecard as well.
Craig, is there a difference in the numbers between the Shawnee County Health Department dashboard and the Kansas Department of Health and Environment dashboard? And if so, why?
Yes, so that's a great question. And so there is a difference. The dashboard, garnering a lot of public input that we've had since the get-go. And I will say that the dashboard is probably the one thing that we receive the most positive input from the community at large. They appreciate the dashboard and the numbers being updated daily. But the dashboard itself is created to give almost a snapshot in time. It's kind of a preliminary glimpse of the numbers as they are reported daily to the health department. So the numbers that we report on the dashboard are the numbers that we pull on a daily basis as they are reported directly to the health department. And so the numbers that we pull for the scorecard, we give the opportunity for that lag. So there are cases that come in lag or because of a case investigation is not completely completed. And so when we wait till the following week, so we pull all of our numbers on a Wednesday, which is why the dashboard or the scorecard itself is released on Thursdays. We are able to then go back and get a more comprehensive look at the previous reporting period. And so when we can delay just a little bit to look at those numbers, it gives us a more comprehensive and a deeper dive into the previous weeks so that we have a better understanding of the trends long term, rather than making impulse decisions on the preliminary data that is reported to us daily.
And is that why we would see a somewhat lower number on the dashboard than what you have reported on your scorecard?
That is correct, because as I mentioned, the numbers that we report are listed by date of diagnosis. And so if a case is reported, say on Sunday, that would not go into last week's numbers, but because the date was diagnosed, whether because they were symptomatic or because of the reporting date, if they are asymptomatic, those numbers would go into the previous week's calculations. And those numbers, we look at that specifically and chose to do the date by diagnose because those individuals, whether they are in the community, moving about in the community or in their household, they are having an impact on the community transmission because they were symptomatic or were tested and positive during that week's reporting period. So it has a impact specifically on the transmission and the severity based on the week that we report on for the scorecard.
Again, I know that you get a lot of positive feedback. I look at the Shawnee County dashboard daily, and I find it a little bit troubling that the numbers that I'm looking at or the public are looking at aren't maybe accurate and don't really reflect what we're using for the scorecard. And so it feels like a kind of getting the rug pulled out from underneath you if you're trying to keep track from home as to where we're going.
Well, one thing that I would say, Commissioner, to that as well, specifically as we're looking at case counts, we are so far above still that 175 case threshold to be considered out of the uncontrolled range. that the minor changes between the cases that are reported and the cases that are by date diagnosed is not going to make a huge impact on the transmission and severity piece. We most certainly can look at making some changes and alterations to the dashboard moving forward. But the overwhelming sentiment and the feedback that we've gotten from the public at large is they like to see a daily look at what the numbers are that day. And so, I mean, I would be more than happy to have a longer or more in-depth conversation about what we potentially could do to either add substance or shift substance to the dashboard. But anything that we would do would be then a delayed response because we would have to then pull those numbers again from KDHE. They update 3 times a week. And we would be looking at numbers that would already be in the past, if you will, for the daily dashboard.
But public trust is such an important piece. And I think it is important that the public be able to trust the dashboard as being accurate. And even if we have to come back and update after the fact but we really should have accurate reflection. And because the public is looking at the dashboard and commissioners are looking at the dashboard and relying on it. And so as we look at, you said that may not make a big difference, you know, one factor can tip us from being at a 17 to a 16. And while we have no control over the schools, I know that USD 501 relies heavily on this scorecard on when they go back to in-person as opposed to an out of school. So our scorecard is not just used by the commission, but it's used by a lot of different entities.
That's correct. Yes.
So, all right. Thank you for that question.
Yeah, no problem. I think it's a great question. And I think it's something that we definitely can dedicate some time to some further discussions about how we can accurately represent the information to the public and make it useful. So very good. At this point, are there any other questions about the scorecard? Any specifics? Would you like me to do just a further overview of the numbers themselves? What would be beneficial for you as the Board of Health?
Can you go back down to that percentage of new cases with no known source of infection?
Yeah.
Can we do a little bit deeper dive into that as well?
For sure. So as you noticed, that was one of the areas where we did have an encouraging trend and a decrease here from that 90 to the 77%. This is primarily due to the increased number of clusters that have been identified here in Shawnee County. So because of that, and those clusters being identified, we are able to then ultimately know where the source of infection has been. We have also been working diligently to increase our capacity for case investigations. We're still hovering around that 80% of the cases that are reported to us being able to investigate. But as we continue to expand our partnership with the AmeriCorps volunteers through the City of Topeka's partnership, hoping to get that number here soon to 100%. And once we can do that, we should anticipate that number hopefully continuing to decrease as we are able to identify where the exposures and the source of transmission is coming from.
Okay.
Craig, on that topic with the no known source of infection, I mean, you mentioned that the reason it went down is because there was a large cluster. We were able to track that relatively easily. But that number has remained exceptionally high since the forming of this scorecard in the first place. Are we spinning our wheels on the contact tracing right now? I mean, is it a lost cause at this point to try and trace the source of every infection? Is that contributing to the uncontrolled, maxed out, consistently maxed out public health system capacity stress?
So I'm going to share another graph here as well. Just it relatively applies to this conversation we're having here. So what you should see here, this is the overarching trend line of the cases that we've had from the beginning of the pandemic here in Shawnee County. The red line that you see there is what we consider the uncontrolled threshold. So if we have a weekly case count that's above 175, we consider that to be widespread transmission. If you see the yellow line there, that corresponds to the time since we've had that uncontrolled index score. So for the 13 weeks that we've had it. So to your point, Commissioner Mays, is we are not able to do a robust contact tracing. So I don't know that we're necessarily spinning our wheels in that sense, because we're not dedicating the appropriate time to the contact tracing, because we are even doing important case investigation because of the overwhelming high number of cases that we receive on a weekly basis. Even with the ability of increasing our capacity, we are still operating on that shortened case investigation form until we can hopefully get to that 100% case investigation, and then add in some ability to do some more robust contact tracing. So what I would be hesitant to say is, even if we're not able to do the contact tracing and everything, that still means that we do not know where the source of exposure is coming from. And when you have widespread community transmission, that means that the virus is everywhere. And so that's why that threshold is at 50%. And so if we are not able to make contact due to the number of cases, or if we are not able to find out where the source of exposure is, that number is going to stay higher and is going to directly affect the score and the severity and the transmission that's happening in our community. Does that answer your question?
Yeah, I think it does. But it spawns more questions. Sorry, I'm pulling things up here, but I guess for me, one of the things that, I mean, can you look at your computer and tell me when was the last time our public health system capacity stress was not at 20? Because it seems like that's been, right. It seems like it has been at 20 on the scorecard for quite a while now.
Let me see, but I think it's bumped to 20 maybe just a couple of weeks ago.
Or, I mean, okay, but I guess uncontrolled. Has it been uncontrolled at our health system stress for quite a while? I mean, it seems like since the beginning of this, it's been that way. And and I guess, and a follow-up question would be, what can we do to help with that?
Yeah, I'm not seeing that right at, so if you wouldn't mind, if we can come back to that, I'll see if I can't have one of our team pull that specifically. As a matter of fact, we just got it. So it looks like back in, 1 second here, on 12/21, our public health capacity stress was at a 17, so not in that uncontrolled threshold. So in the beginning, in the mid-December.
So, yeah, okay.
So you will notice that when, sorry, go ahead, Commissioner.
But along that same line, on the item hospital occupancy rate, which contributes to that public health system capacity stress, you've got that hospital occupancy rate at 90.4, which is up from 90.1. But when we look at the Stormont Vale COVID-19 scorecard that they put out daily, the one that most recent, they were down to 42 patients hospitalized for COVID-19. And it was at Thanksgiving, they were at 120. So they have had a decrease of 80 COVID-19 patients, and the similar for KU St. Francis. How are we still having, I mean, this hospital occupancy rate now isn't the COVID-19 people, it's everybody else that needs hospital care. So how are we still having this very red, uncontrolled for hospital occupancy rate, given that we've had a decrease from 120 to 80 just with Stormont?
Yeah, so when we look at the hospital occupancy specifically, we look at the overarching full medical and surgical beds. So we're not just only looking at COVID patients that are hospitalized. I think that's important to decipher here. And so we're looking at the hospital's capacity to take in other illnesses, other individuals that need to be hospitalized. So we're looking at it as a wide range of the total occupancy of those hospitals and what beds are in use and what beds are available if we were to see a potential additional surge. And so again, when you look at the daily counts, if you look at, say, I think yesterday's Stormont Vale report, which maybe had 44 COVID hospitalizations in
42.
42.
I guess.
So again, the reporting period for this number looks at the previous week. So we're looking at January 17th through the January 23rd. And so that is to ensure that we are getting an accurate representation of a full week and those numbers as we move forward.
But even still, we've had such a huge decrease. Again, going back to our dashboard on the Shawnee County Health Department website, and which I hope that it's accurate. If you were to go back to January the 17th, you were at 83 hospitalizations, and the one yesterday was 63. So at 63, you've had a 50% decrease from Thanksgiving to now. On the 17th, you would have had a 25% decrease, but we still have our hospital occupancy rate. I mean, is that really accurate? Because it seems to me that that hospital occupancy rate has nothing or very little to do with COVID now.
Commissioner, can I make a comment?
Absolutely, help.
Yeah, it is accurate because what you're looking at, again, is total occupancy. While the COVID numbers have gone down, they're still, I think, around 40s to 50s. Most of them have been in the 50s. That's still about twice as much as what we were seeing earlier in the year. That still puts a stress on the hospitals. And that's what our concern is. It isn't, yes, COVID patients are very important and they do create issues, but the occupancy is still an issue because that means that people who have non-COVID problems still are going to be struggling because of the potential for not having the bed capacity or the bed availability, I guess. So yeah, I'm happy too that those numbers have gone down. But remember, when those numbers were way up in the hundreds, we were talking about having refrigerated trucks outside to help with deaths. And I remember Dr. Carnegie and Steve Anderson were coming in and saying, my gosh, we have patients sitting in the halls waiting to be put in a bed. So
absolutely,
I think it's great that the numbers are down, but the numbers are still affected by COVID. And so I think that those numbers are, yes, those numbers are accurate.
It just feels troubling that even where we have this decrease, the community is still being penalized on our scorecard because the hospitals now can treat other people that need medical care. So, and maybe I'm looking at it wrong.
So what I may mention in addition to that is if you think back, even when the cases for the hospitalizations were hovering around in the 30s, those were still extremely concerning to us at that moment in time. And so yes, that we've seen increases, and I think if we can continue on the trends that we're seeing, that here in the next week or two, our community does have the potential to move out of that uncontrolled index. But, when we look at the numbers, we have to, again, as Dr. Cooley mentioned, we have to look on the stress from the hospitals and their ability to see those additional patients as well. So while it's improving, again, I think that's represented by the case numbers as well. While the numbers are improving, they are still higher than what our entire community can handle. And that is why you still see us in that uncontrolled range. Other questions?
Commissioner Rippon, do you have any questions regarding the scorecard? And you're muted.
I had a question for Dr. Cooley or Craig. On a normal year, what percentage of occupancy do the hospitals usually see? What's a normal?
They'll usually run in the high 80s, I think is what I've been hearing around here, to the 90s. And in the winter months, you tend to have a little more. But they tend to run about that. They don't like to be over 90%. And that's why you see that when it says that they're in that red zone is when it's above 90. They don't like to do that. They don't like to be that high.
I was running the numbers here the other night, and right now we have a 0.65% of our population, Shawnee County, is confirmed to have COVID. This is as of January 22nd. That 0.65, that's 65/100ths of 1%. I'm having trouble reconciling that with uncontrolled transmission. I don't know. I just looking at the math, it just doesn't seem like that should be uncontrolled.
So again, we're using thresholds that we are receiving from the state, from the federal government, and any cases that when we see cases that are above 175 per our population base, that's considered a widespread community transmission. Dr. Cooley, anything you'd like to add to that as well?
No, that was just what I was going to say. These numbers have not been picked by us. Those are numbers that have been used by the CDC and by the state and by epidemiologists, and they are determined what would be considered to be uncontrolled by epidemiological data.
I guess, kind of going back, looking at the overall, with the number of decrease, I'm glad that we are moving in the right trend. It just feels that, it's surprising that we're still at a 17. Commissioner Mays, do you have any other questions regarding the scorecard?
No, I would just say I think we've been using this same scorecard for quite a while. And I feel like some of these categories and some of these thresholds were appropriate when the scorecard was initially developed, but I think it probably could use a little bit of retooling. And I think that would be a great thing for Dr. Cooley and for Craig and for Dr. Locke as she gets onboarded to reassess and see if changes need to be made to the scorecard to reflect our current situation as much as possible. Because I don't know when this was developed, but it seems like it was 4 or 5 months ago maybe. And so much has changed. It's just, I think vaccinations probably need to be a part of this scorecard as well. The amount given as a percentage of our population, things like that, I think need to be something that we take into consideration as well. So, I mean, it is what it is. This is what we've got right now. But I think that, the data that we use to determine this scoring, I think is something that we need to consistently reevaluate to make sure that it's accurate. So that's all I have to add. I don't have a whole lot of other questions.
Okay.
At one time on KDHE's website, I found what I thought was very interesting. It was a chart that showed where the transmissions are coming from, whether they're coming from schools, nursing homes, bars, sporting events, people's homes. I found that really interesting. And I think as people try to create policy like we do, that's good information because a lot of those sources, schools, restaurants, bars, they weren't really generating much. It was mainly coming from people's homes and from nursing homes. And I thought that was good information. Another thing I would always like to see, I don't know if it should be part of a scorecard, but somewhere on our site, I'd like to show what our recovery rate is. Because I know a lot of people are scared if they get this, they think they're just going to die. But a recovery rate, even if it was kind of broken down by age group, maybe pick 4 age groups. I think that would be good information as well. So that's all I have to add. I have one other question about in our order. When we first started out, we had when we talked about close contact, we talked about wearing masks, but we also talked.
Commissioner Rippon, we haven't got to the order yet. We're just talking about the scorecard.
Okay, I'll hold that for later.
You're jumping ahead of the gun there just a little bit. So.
Sorry, I'm sorry.
So
We all know
one
what
point
the basis of the Board of Health was for today, was to discuss the health order. And so I can understand the want to jump ahead to that as quickly as possible. So,
but I guess we will continue to monitor very closely, and again, kind of taking into consideration some of those comments about our scorecard, what we look at, and I think those are would request that the department reevaluate and make sure that we're still compliant and on track. And does this really reflect our community?
yeah. And I think we have a great opportunity, as Commissioner Mays mentioned, with Dr. Locke coming on board starting next Monday, to kind of look at some of these specifics. I think anybody when you look at with data is hesitant to continue to move the goalposts because then you're shifting what you look at and how that works. So, but we will definitely I've been taking some good notes here, take your thoughts and comments and take them back to our team and see how we can best address those. So don't be surprised if you get an email or phone call from myself or one of the other us to talk about this a little bit more in depth to see how we can assist you as the commissioners, the public, and the Board of Health. So
I would welcome that. It's always good to talk with you folks.
Very much.
Dr. Cooley, I think you're up next. Teresa, is that right?
Yes, that's correct. I was just going to say thank you to Craig for presenting that, and Dr. Cooley, and we do appreciate your comments. And we, as Craig said, we will review the feedback and be in touch to see what improvements we can make. But yes, we'll turn our attention to Dr. Cooley, who is going to lead us on a discussion of the updated health order that was just released this morning.
Well, good morning, commissioners. Dennis Cooley here, the interim health officer. And I want to, before I get into the health order, I just want to welcome Dr. Locke. I certainly look forward to working with her. I'm confident she's going to do a great job. And just as you said, Commissioner Cook, I'm very excited that she's going to be taking her on Monday. So thank you. You saw the scorecard, and we've had some discussion of it. A couple of things that I want to point out, because certainly those are things that we look at I look at when we make the health order, or when I make the health order. It is encouraging, and I know that that's what we've all seen. It also, though, has some serious worry. I don't want people to look at the scorecard as punishment, though. It's not. It's a reflection of what is going on, and sometimes it's like, it's like a scale, a weight scale. All right. When the scale, if you're trying to lose a certain amount of weight and your weight is high and you get it and you've lost some weight, but it's still up higher than what you want, it isn't punishment that the scale is telling you. It's just trying to reflect what the situation is. And that's what I think the scorecard is. So it's encouraging because we've seen some decreases in certain areas. There's still some areas, though, that are uncontrolled. We have 5 of those, by the way. And I think case numbers is one of the ones that I worry about a lot. We had 600 cases this last week. That's high, obviously. It's what's difficult is that we've gone from that 1,000 number down to 600, and that sounds like, and it's a good improvement, but it's still 600. That's about 3.5 times higher than what it would be if you wanted to get out of that red zone for case numbers. Hospitals, we talked about that a little bit, and I as I mentioned, that we're still seeing high numbers compared. They're not as high as they were back in November, and thank God of that, but they're still high, and they're not down to where I can tell you the hospitals would be more than happy to have them much lower than that. The percent positive was down, but if you look, it's really just barely that. It could pop up the next time we do it above that. It was 7.9%. So it's encouraging, but I think that's not where I want it to be. After consulting with the technical advisory committee, I made the following changes that I felt we could make to the health order that would still allow us to maintain our current trends. And so if the changes are really, if you look at the sports and athletic activities section, I'll read those. Sports and athletic activities are allowed subject to limitations of social distancing and mass gatherings. Spectators of sporting events should follow the mass gathering rules. For For team sports, 2 teams combined shall be considered as one mass gathering whose size shall not exceed 25 people. These individuals are included in mass gathering size. And then for events open to the public, organizers shall enact necessary measures to assure social distancing. Mass gathering rules are applied for the public, and bars, concessions, restaurant areas shall meet the same requirements of those not located in the venues, and mask wearing is mandatory. I'll get back to that and why I made those changes, but I do want to just point out one other change that I made to the health order. And this is really more of a clarification. This is under the child care and summer camps, and it's the last bullet. Licensed child cares must follow state guidance and requirements. This order is not intended to exempt licensed child cares from state requirements. There's been some confusion thinking that we can change those, and we can't.
Okay. And before we get into your health order, just some, I guess, housekeeping clarification. Again, the Shawnee County Board of Health does not have any authority or control over the university, MIAA, NCAA, school districts, Kansas State High School Association, or Kansas Department of Health and Environment when it comes to daycares. Well, all of those are outside of our regulation.
That's correct. Yes, thank you. So as far as the sports goes, we looked at data. I looked at our data, and tried to look at, has there been any spread of cases on indoor courts of competition, like basketball courts, hockey arenas, et cetera? There's only been one case that I know of where that happened. That was in June, and it was with a hockey team in Florida. So we really have not seen that during competition, during the games. So we looked at then feeling that because of that, we don't have any good data that says that that's an area where you're going to get some spread. We felt that we could try to open that up. To do that, to allow teams to compete, we had to expand a little bit with the size of the gathering, only for sports, only for team competition. And we tried to pick a number that would allow teams to play games, to compete, but still allow for safety as far as group sizes. And so that's where we came up with the 25 number after thinking about it with team sizes, coaches, and referees too. And the other issue was that a lot of this involves youth and children who are younger age. They tend not to have as much transmission. And we felt that certainly it is important for them to get out and play and do exercising too. So those were the reasonings why we felt we could safely go ahead and make those changes to the health order.
Okay. Doctor, yes, if we can go through your health order. Let's talk about the youth sports and activities. This is going to open up the ability for tournaments. Is that accurate?
They would have to follow the guidelines for mass gatherings. So it would be a very small tournament if that's the case. I mean,
but if they can have 25, and that's 25, is that going to be enough for 2 teams to compete against each other?
It should be. Both teams with a couple of coaches and referees. Most teams, we feel, if you allowed 8 to 10 per team, and then you had a couple of coaches and referees, then that should be able to fit that.
Okay.
We picked a size. You could, some teams, a team could say they have as many kids as you wanted, 40, 50, whatever. And of course that defeats what we're trying to allow teams to compete, but we're also trying to maintain smaller sizes for the safety of that.
Well, I can just,
go ahead.
Oh, go ahead.
Go ahead.
Well, I'm just saying, I mean, when you look at what kinds of winter sports there are, you're talking basketball, maybe hockey, volleyball, indoor soccer. None of those are large team sports like football would be. And so I think 25 should accommodate most teams. Even baseball, most rosters for Little League and things don't carry more than about 12 kids. So, I mean, it should be sufficient.
But this is increasing the gathering size from 10 to 25 when it comes to these sporting events.
For just the teams, yes. but it does not increase the size of the entire gathering. In other words, that takes away from spectators too. That number goes, the spectator number. That's included.
We were asked and have been asked by a number of the churches in the community about right now, our current mass gathering restrictions are at 100 when it comes to those services. If you have a facility that is really large and with social distancing, are we still looking at limiting that to 100, or is there any consideration to changing that?
We did not feel like we could do that at this point. At some time in the future, obviously, if we keep the trends and we keep going down, then we would certainly consider that.
Okay. Bars and restaurants. It's a topic of consideration for a lot of people.
Sure.
As we look at bars and restaurants, we have Wyandotte, Johnson County, and Sedgwick County that are, a couple weeks ago, we talked about them opening up and having more expanded hours, but we left ours at 10 o'clock. Is there any consideration to changing our bar hours or restaurant hours?
We looked at, when you think about bars, we looked at bars, and we always do consider these things, or I do, and I talked with the technical advisory board too on this. So the data shows, we know that bars and restaurants are places where transmission occurs at a higher level than in other places. CDC has data that shows that. Johns Hopkins has data that shows that. Stanford has done studies that show that. From Europe, we have some data that shows that too. So we know that there is anywhere from upwards of 2 to 3 times maybe transmission in bars and restaurants. The fact that we haven't seen a lot of clusters right now in our area, in our county, I think has a lot to do with the fact that, let's face it, we have restrictions. Our restrictions are working. That's why you don't see that. And you can see that in places where they do have these limitations, then you see the numbers go down. It makes sense in that. I think the other counties, I'll be honest with you, I don't know what their decision was. I don't think all of our counties around us have opened up that much. I think Douglas County is similar to us. But I'm not sure that even matters though, because what we need to do is look at what our situation is in our county. And we felt that we still feel that it is important that we maintain the 10 o'clock. We have a Super Bowl coming up next week, go Chiefs. But that's a worrisome time right now. I'm worried about the Super Bowl and what effect that's going to have on our numbers. We are very close right now. We're very close in our scorecard to getting down into that high risk rather than the uncontrolled. And I don't want us to lose ground on this. I don't want us to now pop back up and then we're back to looking and waiting longer and longer time. So
right.
I think
playing the devil's advocate here for just a moment.
Okay, sure.
If we continue with our bar restrictions where they're at, are we pushing more people into house parties, small gatherings, where we know we have a higher transmission rate? And that is, we have a lot of data on small gatherings being a hot spot for transmission. Are we forcing people or encouraging people, maybe the better word, into this as opposed to being a bar in the restaurant? And as you well know, I have held more of a strict line when it comes to bars and restaurants and trying to decrease those gathering sizes, but is our efforts having the converse effect? Asking as the devil's advocate.
I think that that's an important reason why you want to make sure that, first off, that you do limit the size of gatherings to 10. Because I think that if you say and opened it to even more than that, then people are going to understand that. Are we going to see that in Super Bowls? Yeah, I'm worried that we do. I worry that we are going to have more Super Bowl parties, et cetera. But I don't think that opening up the bars is going to make a difference with that. I don't think that saying, oh, hey, we're going to open up the bars till people can go to the Super Bowl, can watch the Super Bowl at the bars now. The game starts at 5:40, is going to end at about 9:15.
But
And
you're
so-
relying on Commissioner Rippon telling the 11th person at his door, I'm sorry, but you need to watch the game from outside. And no one is policing this. Is
Nobody's-
that realistic?
I don't understand. I'm missing that a little bit. What I'm saying is,
If Commissioner Rippon has a Super Bowl party
correct,
and he invites people to his house,
correct.
when the 11th person, if you're the 11th person, you can watch from the driveway.
If he want, I mean, I'm not going to police anybody. We're not going to do that. But I think that gives people a good guideline to know. If you all of a sudden up the gathering size, then I think that people would say, oh, okay, well, hey, we can have way more than that. So
I think
that I don't think we're going to have anybody who's going to drive around checking to make sure that people have that number in their parties. But I also don't think that extending bar hours means that people are going to say, well, hey, I'm not going to go to my friend's house to watch the game. I'm going to go to the bar instead. They can still go to the bar and watch the game and watch the entire game. So I'm not sure that extending the hours is going to make a difference in that.
the only thing I see in extending hours is right now we got a bunch of young people are going to Kansas City to bars, and we've got them driving back after an evening of drinking.
They'll be driving. They would be driving back, Commissioner. If you left open up till 12:30 here, they'll be driving back in our city too, same way.
Yeah, well, they'd be home. They'd be in town rather than out on the highway. I think we're probably going to force people into clusters on this Super Bowl. I mean, they could go to the bar. It's early enough in the day, but there are other events. There's basketball games and stuff where the bars tend to fill up, and they're later in the evening, and I know those people, they just go to someone's house. And I think a lot of these kids, anymore, they don't go to the bars till 10 o'clock, a lot of them. And what are they doing now? They're probably just going to other people's homes, and who knows how many they're packing in there. And, I'm sure it's the cleanest place in the world too.
Well,
how
and
they
I
are.
guess,
But I think your point is taken, though, Commissioner, is that that we know that a lot of the activity in bars is at 10 o'clock and later. And so you're going to be decreasing that when
I guess the question is, would you rather have them in a bar where they're cleaning some things and watching a little bit, as opposed to just somebody's house when they all pile onto the couch? And I don't know.
Doctor, that was going to be my
I would say
question.
most bars probably have a few more people too, though, than what you get in the homes.
Yeah, the question was going to be regulation versus unregulated activity. In homes and in houses and in small gatherings, we have no regulation or ability to regulate, whereas bars and restaurants, we do have some. But I understand the arguments on both sides. Commissioner Mays, questions, thoughts?
Yeah, I've got a few questions. I think that one of the things that we're talking about here is other communities, and we look at Riley County, Johnson, Wyandotte, all have moved back to a midnight closing time. In fact, I believe Riley's been at midnight for quite some time now. Has it made a difference in their numbers when you look at trends comparatively to ours? I mean, are we in a better position than them, or a worse position than them, despite our regulations? Or, I mean, is that something you guys consider?
I would look at their data if they had it, but my guess is they don't. I've not seen anything.
Okay.
I mean, it would involve some probably more contact tracing than I bet they have been doing, I guess. I have not seen any data on them that shows that they have not seen any decrease or have not been seeing cases coming from the bars that they've left open. I have not seen anything that they've shown.
Okay. And then Dr. Cooley, would this be a good time to encourage people that, maybe a few days out from the Super Bowl, they all go utilize our free testing facilities in town and maybe have a better idea if they're a carrier or not?
I certainly think that may be. That's certainly something they can do. especially certain, obviously if people get symptomatic, you bet. But I think they need to be aware of the fact that try to follow the what we tell people. And I know people don't like wearing masks, but masks are important, especially if you're not in their bubble. So you wear a mask, you stay as distance apart. Okay, nobody's going to go around with a tape measure and measure 6 feet, but you do stay apart. You don't have to sit there and get as close, and wash your hands and keep things clean. And so I think if we follow those things, those are helpful. And I certainly would advise everybody at Super Bowl parties to do that.
Thank you.
I noticed early when we had the health orders, when we talked about having 6 foot of distance, we also had a time limit in there. It says being with someone for 10 minutes at a distance of 6 feet. That's the way it used to say. That's the way it was written before. Why did we drop the time period? Was that found to be ineffective, or?
I'm not sure what, I'll be honest, I'm not sure what the time period was. The 10-minute time frame has to do with quarantining. And we consider that a close contact exposure. It is 10 minutes or more that you've had that contact. I'm not sure what the
well, this was more with, it was more, do you need a mask or not? And you should have a mask if you couldn't maintain the 6 feet, or there was a time period. So in other words, if you just met somebody in the hallway, that was considered, you didn't really need a mask for that, the way I read the order. But at some point in time, they dropped that time period, that time allowance. And I was just wondering if that was just
it's still what we use.
Something the CDC came out with, or somebody else, I don't know, but it was dropped. And
again, I'm not familiar with where it was on a health order.
Okay.
I certainly know that it's still used. We still use it when we determine whether somebody's been a close contact and whether they need to be in quarantine or not.
No, this wasn't part of that. It was different. So, all right.
Dr. Cooley, can you, I know I get questioned again. Part of the Board of Health is to answer some of the questions that we field as commissioners a lot. Sure. But a question that comes up on more than one occasion is people being able to sit at bars or sit at as opposed to a 4-top table or a table with 4 chairs in a restaurant or a diner. Where do we stand on the ability to sit at a bar or cafeteria?
I think generally when you're thinking of those situations, you think of, again, are they people who you are kind of in your bubble? So in other words, if I go there with my family, that's my bubble, then I can sit in that table and chair. I think if you're sitting with people who are not, that you don't have much contact with very often, I think that then again, you should follow the rules as best you can, which is, 6 feet, mask, and, following those mitigation type things. So when we see that, I see people together. I don't know if they're in a bar, if there's 3 or 4 of them together, are they people who associate frequently together, or are they somebody who, are just friends that they haven't seen in 2 years? That makes, I think, a difference. And so, what I would recommend again is if there are people who you have contact with frequently, if they're in your, what we call bubble, then, you can certainly sit at the same table together, et cetera. When you're at a restaurant, at bar, you're going to have your mask off at times when you're eating. If you're not, I think people who should wear their mask as often as they can and stay as distant as they can. I don't know if I answered that question, but it's.
And I was really kind of thinking more about, when you're sitting at, right now our rules prohibit sitting at any bar.
Like at the counter.
Countertop. Yeah.
I think I understand.
Yeah.
The issue with that, I think it has to do with, again, it's having people who are not in a bubble. When you're sitting at a table with a group, that's the group that you normally with. When you're sitting at a bar, you're going to have people who are individual, who are going to be standing there, who may not normally be in contact with each other. That's the way I would.
If they are spaced out and have spacing between them. Is that still ill-advised or unfeasible?
I think you'd have to make sure that they were 6 feet apart. And you'd have to make sure that, that they don't move together. Whenever I've been into a bar and I'm standing at the bar, I will guarantee you that people crowd together and people go up to the bar to get a drink. And so I think that would be very, very difficult to maintain that.
Dr. Cooley, so I know that we haven't seen this in Topeka or Shawnee County because obviously we've had the regulation that bar service is not available. But I can tell you, I went to a restaurant in another city recently where they were allowing it. And what they did is they had dividers put between groups of bar stools. And so you would sit at two stools basically between two dividers. I think might be something to consider down the road.
Yeah, and the difficulty with dividers is if they go all the way up to the ceiling, you're great. If they don't, because of aerosolization and stuff, you can't guarantee, I don't think very well that it'll how much can cross over and how much won't. They may make some difference, but it's hard to know.
Commissioner Rippon, questions?
I just have a question about herd immunity. Are we getting close to what you'd think is herd immunity, or do we need more vaccination before we get close to that?
The answer I think I would say is, are we getting close? And I don't think so. I think everybody seems to think we need to have about 70% or so of the population that is not susceptible. That means they've either had the natural disease or they've had the vaccination. And so we need more vaccination, I think, to get us there.
Okay. And as far as vaccinations, I think you told me the other day we're getting like 1,900 a week for Shawnee County. Is that?
Yeah, and I'll go over I think I have an update on.
Commissioner Rippon, that's next.
Okay,
Vaccinations are next.
Sorry,
Jump the gun in.
Yeah.
So.
In here, Commissioner?
Yes.
I wanted to add another comment to the herd immunity. I know it hasn't been discussed today, but we are watching the variants, the South African and the Brazilian variants, and there is some concern that in reinfect individuals who have already been infected with the original strain. So that will play a role in the herd immunity.
Very good.
Doctor, your health order, again, I want to thank you for your service as our interim health officer. So this is your health order today. It becomes Dr. Locke's health order, well, as soon as we get done here.
Monday, I think.
Or Monday. I'm passing it off too early. Our time frame for review, knowing that we are, again, knock on wood, we have been moving in a positive direction. We did do a 2-week review. I don't know that I feel comfortable doing a month review because that seems like a lot can happen in a month. Do we want to look at this in 2 weeks, in 1 week, in 3 weeks, in 3 months? What's the recommendation?
If you're asking me, I would be happy to, I don't think you should look at it in anything under 2 weeks. I think that gives you past the Super Bowl and it gives you a little bit of about a week or so after that.
Okay. Any other questions? Go ahead.
Well, I'll just say with regards to that, my preference would be not to do a full month. However, with a new health officer coming on board, I'm not sure if it's fair to her for us to, put a short deadline on this and have her immediately go into a new health order right away. So perhaps Dr. Locke would have something to say about that.
Yes, I would actually prefer 1 month. You know, if we make too many changes too close together, it's really difficult to evaluate what's working and what's not. And as I am going to be getting myself up to date on all of the workings of it, I would need to have a little time to do that.
Well, my concern is this. People are restless. COVID fatigue, again, we talk about it. It is real. It's very similar to spring. When you have a couple of warm days, everybody thinks about gardening and doing yard work and getting your house ready for the spring. When we have had a couple of good days or a couple of good weeks heading in the right direction, I know that my phone call list, my contacts within the community are wanting to know, when are we going to change restaurant and bar hours? When are we going to change gathering sizes? When are we going to increase the ability to resume normal if that is ever possible? When are we going to get to school? And I immediately say, I have nothing to do with that. But those are the questions we get hit with. And I know that we are putting between a rock and a hard place, again, between that public policy and public health. And where those two meet creates a lot of friction.
Yes, and a lot of these, it's 2 weeks, it's their business that's hurting. And it's very serious to them, you know, they're just hanging on. And so, you know, I think if we see a change, we need to be flexible and move forward with new orders. But these people they are seriously hurting for money. And we can't just keep putting them off. If we see our numbers changing, we need to be able to react quick. So
both positive and negative.
Just real quick to Commissioner Rippon's point, the order that is put in place does not restrict us from adding an additional order in less than the 4 weeks. The 4 weeks at this point in time that the order is posted is that, if you will, the deadline for that order to be expired. So anytime that a health officer issues an order, there is the ability for the health officer to then issue a subsequent order that will then rescind that order in a shorter amount of time. So if Dr. Locke, as she begins to transition into her health officer role and gets the idea and gets the data that she would like to have to look at updating that order, there's nothing that restricts her from issuing an additional order in a shorter time period than the 4 week time period. So I did want to make sure that I clarified that. The additional piece, and I know Dr. Cooley mentioned at the very beginning, when you asked about the recommendations, I would be remiss if I did not mention that, again, the Public Health Technical Advisory Board has had the input on this order as well. And so, again, looking at that 4 week window was something that was discussed with the Public Health Technical Advisory Board as well. So, thank you.
At this time, Commissioners, before we move away from the topic of the health order, do we wish to take any action on the health order as the Public Board of Health, or do we wish to have it stand as it is presented from Dr. Cooley?
Commissioner, I think there are some folks that might be wanting to speak from the public.
Okay. All right. Very. Stephanie, if you would assist me as to who we have that wishes to speak from the public. Maybe unmute them or allow them.
Yes, I'm ready. Scott Huston with Vikings Grill.
Good morning, Scott.
Morning. Appreciate you guys. I'm not sure if you can see me. I can see you all.
We have your name.
Thanks for the opportunity.
Right now.
Okay. Thank you for the opportunity to speak. Obviously, unprecedented times. I know all of you guys are working hard, trying to do what's right for the community, residents. That's what you guys are here for. I've dealt with all of you before, other matters, and I feel like everybody is definitely trying to do what's best by the community. I believe that. You know, the COVID pandemic's been unlike anything in my lifetime. I'm sure all of yours as well, and probably the toughest thing as commissioners you've had to wrestle with in terms of trying to please everybody. My parents, both in their mid-70s, they both had COVID. I'm sure, I believe Commissioner Cook and Commissioner Mays either had it or had family members close who had it. And, you know, I think everybody has either had it or knows somebody close to them who has. So it's very common to all, I think, at this point. I am excited to hear the information you guys were discussing earlier about the numbers going down, vaccines obviously going out. It was interesting, Commissioner Rippon, you know, hearing I believe you said less than 1% of the community currently has COVID. That's about as low of a number, I think, as you can get. It's less than 1%, so that's good. And if I also heard correctly, the hospital capacity rates were in the low 90s, if I heard you guys correctly. And I also believe I heard that that is what is typical for this time of year, either way, whether it was COVID or last year or the year before, if I heard you guys correctly. Upper low 90s is where it normally is at this time of year. Again, please correct me if I heard that information inaccurately. I know the restrictions are being removed nationally. Everybody obviously hears what's going on a national level. And again, good news. Speaking on my own behalf, I have a restaurant in North Topeka. You know, we've been dealing with all of this for the last 12 months almost, as far as the restrictions and, you know, all of the, you know, whether it was curbside only, whether it was 12 o'clock, 9 o'clock, 10 o'clock, you know, we've obviously dealt with everything. We follow the guidelines, you know, we've invested into our business. All of our tables have 6 feet between them. We've removed games and tables from the facility completely to accommodate 6-foot distancing and to be able to have adequate tables so we could ultimately stay open. We have, you know, all of our staff are fully masked at all times. Kitchen wears gloves and even follows more restrictions. Signs posted everywhere for the patrons to wear masks while not eating and drinking at a table. So it's, you know, full communication. I've invested in hand sanitizers in multiple locations throughout the restaurant. I've actually built wood barriers between all booths. You know, I looked at it as I'm not going to just put up, you know, plastic barriers. I'm going to invest into this for the long haul. So we really put the barriers up for forever because I believe that to be a good idea. We have weekly staff meetings to discuss sanitation and cleaning and making sure everybody's following, making sure if there's any staff who have been exposed to anybody that they're self-quarantining and communicating. And, you know, we've not allowed some staff to come to work, even though they argued with us that they should be able to because they were around people. So we've taken all measures, I believe, seriously and enforced it. I feel like we're doing, you know, we're running a good operation and managing the situation as you guys would all desire. You know, from what I've heard and gathered and read over this entire period, it seemed, you know, somebody mentioned earlier the Shawnee County information that was put out publicly talking about where the spreads come from. One of you guys talked about that earlier, that, you know, it came from senior assisted living, it came from big, you know, plants and things of that nature, and personal homes being at the top of the list. You know, those, if I'm correct, are in your probably the top three categories of where the spreads have originated and come from. And then they work their way from there. So with that said, you know, I'm glad to hear that the schools are reopening. I have 5 kids. They're all in the Seaman School District. They're, you know, the older kids go to school half the time. The younger kids go to school all the time. So there's a juggling effect there, but they're all going to school. It's good. They, you know, they're wearing masks at school. They have dividers up. They have, you know, they wash their hands. It's controlled. There's systems in place. Therefore, they're not having, at least knock on wood, but where my kids are, they're not having issues with COVID. There's no spread going on because I believe that they're in a controlled environment. So it's keeping them safe. I do think the masks work. They, you know, keep influenza away, let alone COVID and flus and whatever else. So there's benefit there. I think that everybody's seeing. You know, what I would say, you know, I respect the doctor's wisdom and knowledge, and, you know, and I'm sure if in a perfect world, everybody followed the rules, which I don't think that's the world that we all happen to live in, but if they did, I'm sure that would work out great and everything would be fine. You know, the spreads occur immediately following holidays. We've all seen it repeatedly. It's after holidays. They've happened after, you know, political events and rallies. And these are the things where there's always, you know, a week or two after where the spread and the numbers spike up. That's where it comes from. It's where it happens. And, you know, I can tell you as somebody speaking to the public, thousands of people weekly over the last 12 months, half the people, they eat their dinner and they probably do go home for the most part afterwards. But unfortunately, again, reality, then there's the other half that say, well, and I can tell you with the 9 o'clock restriction, it was a definite they're going elsewhere. They're going to run to the liquor store and go to a friend's house, and they don't care what the restrictions are. And what I know for certain is when they go to these houses, there is no masks. There is no 6-foot distancing. There is no barriers. It's a free-for-all. And as Commissioner Rippon said earlier, they're sitting on the couch together, and they may go ahead and stay till 1 or 2 o'clock in the morning together as they continue to drink. That's reality. That's what's happening. That's what happens on the holidays. That's what will happen on the Super Bowl. Guaranteed, I would wager any amount of money on that. They won't just all stay home with their immediate family and watch the Super Bowl. That won't realistically happen. Just like realistically in the last 12 months, nobody stayed home for the holidays. They all went wherever they went, and then the number spiked up immediately after. That's what will happen after the Super Bowl, in my personal opinion. People work all week. We're creatures of habit. When Friday, Saturday arrives, they want to see friends. They want to socialize. They want to have dinner and drink, and that's part of a ritual of life that some portion of the population just isn't going to say no to. And again, especially a year later of attempting to do it, they're at their breaking point. They're done. You know, last weekend I was at the restaurant. It was, I don't know, 8, 9, 10 o'clock, whatever time it was, basically right after dinner. And I'm talking to groups of people, and they're, well, we're, you know, after we eat dinner and have a couple of drinks, we're heading to the casino, and that's where we're going, you know, or we're going to Jimmy's house and he's having some people over and we're going to watch a basketball game. I mean, that's just the reality. I mean, that's what's going to happen. I wish, like I said, you know, everybody in the world would just follow the rules, but as it hasn't happened in the last 12 months, I don't think it'll happen in the next 12 months. You know, I would also
Scott,
say, I don't know about you
Scott.
guys, but when you restricted the hours from 9 o'clock to 10 o'clock, the numbers didn't go up from that. If anything, what's happened? Numbers have gone
Mr.
down.
Huston?
Yes, sir.
I was just gonna, sorry to interject, but if you
Absolutely.
could, if there's a question or a act that you're asking the board to look at or take, if we could,
Yeah.
again, trying to be a little bit, making sure we're understanding what it is that you're wanting us to be cognizant of.
Okay, perfect. And I appreciate that. So right to my last point, did the numbers go up or down when we changed the restriction from 9 o'clock to 10 o'clock?
When we went from 9 o'clock to 10 o'clock,
Correct. When we changed the restriction, you know, a month ago, whatever it was, from closing bars at 9 o'clock and we moved it to 10 o'clock, did the numbers reduce or increase?
Dr.
That would be
Cooley?
my question.
Okay.
I believe, if I'm right, we changed that numbers just before Christmas, and so you saw the numbers all go up.
Okay. All right. Thank you.
Okay. So I guess my last, question would be is, do we ultimately believe that, that people will, so we're basically suggesting that if we close at 10 o'clock, everybody goes home and that nobody will go to houses or casinos or other places. Because if they go home, I agree with, actually it was Commissioner Cook and Ripham, that they're going to go elsewhere, which will cause the numbers to rise. And I agree with the doctor. Christmas being one of the holidays I was referring to earlier, that is a time where people are at houses together. So that you would expect numbers to rise when people are at homes together. So that, to my point, I think midnight actually is the number where at 11:30, 12 o'clock, people say, well, it's late enough, I'm going home now. I'm not going elsewhere. I will go home. And I believe that's why other counties have adopted that time frame as well, because that's, I think, logical. That's all I have.
Thank you.
Thank you.
Okay. Our next public comment, now you'll give your name. You're identified on the screen as B Ward 311, but if you could give your actual name and public comment.
My name's Brian Ward. I don't have any comments. I was just watching.
Okay, thank you.
Yeah.
The third person signed up for public comment, Craig Heidemann. If you have any public comment regarding our health order.
No, I don't have a comment.
All right, thank you. Those are the three individuals that were signed up. Any other comments based on the comments made by Scott Huston, or in reflection, having had a chance to kind of think about it and mull it over? Okay. All right. Then at this time, I mean, if the board takes no action, the public health officer's order stands until our next review. Obviously, we have the ability to review orders earlier, but if they need to, if there's issues that arise. Teresa, our next item.
Good morning again. All right, we are going to move into the COVID vaccine update, in which both Dr. Cooley and Craig will give an overview of. We welcome questions.
Thanks, Teresa. I'll go ahead and start. A couple of things, just some general items. First off, we've been vaccinating everybody in phase 1 Since December, we're starting phase 2 now, and we're following the guidance of KDH&E as far as our going into phase 2. Our partners in the community vaccination efforts have been Stormont Vale, KU St. Francis, Grace Med, and the VA hospital. We've been meeting for many weeks now, many times, often, well, not many times, but always multiple times during the weeks, trying to determine the best methods so that we can get more people vaccinated in the quickest time that we can. And we, though, are following restrictions and guidelines from KDHE. And I just want to thank all those groups, Stormont, St. Francis, Grace Med, VA, for all that they've helped us with on this. This is a very, very complicated effort that we are seeing. We are currently finishing up phase 1 doses. We're getting our second doses of those. And anybody who is in phase 1 and has not yet got their first doses, we're obviously going to do those too. But I think we've pretty much got most of the phase 1's doses, at least those first doses, out of the way. And we're getting a lot of our second doses done. The total number of doses that we have that have been given in Shawnee County is upwards of 19,000. Now, I want to just make a point here is that we do not get the information from the pharmacies that are doing the long-term care facilities. So in other words, those were all through the federal government. It was CVS and Walgreens, I'm sorry. And they have vaccinated the long-term care facilities and the long-term care facility staffs. So that number of 19,000, that's how many that we know of. There are many, many more than that with our long-term care facilities. Let me just kind of now just go into phase 2 and where we are with this. So we're receiving information almost daily that we get from KDHE to really kind of help us get through this situation. And I know we keep using this term fluid, but that's exactly what this situation is. Most of the time we will get information and we have only like a 1 or 2 day kind of heads up on when we can do something or how we can do something. And that's also what KDHE is receiving too. They are getting their information very quickly from the federal government. KDHE is only receiving about 40,000 doses a week for the entire state. So I'll kind of let that sink in for a minute. And of those 40,000 doses, we get 1,950. So 1,950 doses a week is what we're being allocated right now. All the doses that we're getting right now are Pfizer doses. I'm sorry, Pfizer vaccine. So there's two types of vaccines right now. There's the Pfizer and the Moderna. The Pfizer is the vaccine that requires the very low freezer temperatures. And the only facilities right in Shawnee County that have that are our 2 hospitals. So they are the ones who are going to have to be storing that vaccine. We are not getting any Moderna vaccine at this time. Our estimates right now are that we have about 65,000 people who are in phase 2. So you can kind of start trying to do some math here and you're going to see that that's a large number of people with a very small amount of vaccine that we are getting on a weekly basis right now. I want to emphasize that we do not determine who is in the different phases. KDHE has determined that. So in other words, when somebody calls us up and says, I'm in phase 3, but can't I be in phase 2? No, we can't make that decision. That is done by the state. What we can do is sort of sub-prioritize people that are in our phase right now. So in other words, we can prioritize the people who are in phase 2 in our county. And we actually have started doing that. We are prioritizing our 75-year-old, well, actually our 65 and plus, but we're really starting at that 75-year-old level. We're also, we've already started on those. We're starting on our first responders, and we've already done a number of our law enforcement. And we're next going to be looking at our K-12, our teachers, and our congregate settings. Now, I want to just make sure that everybody understands that we're not going to stop when we get there. Those are the ones that we're trying to get to first. As vaccine becomes available, we will then vaccinate more people from phase 2. You know, and as you saw my numbers that I gave you, so we're asking for a lot of patients here. We're working with very small amounts of vaccine, but what we are expecting and what we've heard is that we will get more vaccine as it becomes available. So we're expecting that the amount of vaccine that we get per week will start increasing. When that happens, though, I can't tell you. I can tell you that we're working very hard with our community partners. We want to try to improve our communications, notifications, and scheduling. I know that's been a real issue in the last few weeks. We're working on that. We're trying to explore ways that individuals in phase 2 who maybe do not have smartphones and maybe do not have computer accesses, how we can help them get onto our list. We have a survey for people in phase 2 that they can fill out that puts them on a list for us. We're looking at ways to vaccinate individuals who may not be able to go to a vaccination clinic, who are homebound, et cetera. And finally, we're looking at ways that we can provide vaccine to our underrepresented populations, who at least we've seen that they seem to have a larger number of cases. If we're successful, I think, to vaccinate quickly in Shawnee County, our residents, we're really gonna have to have a community effort. It's gonna have to be kind of a all hands on deck. We're going to need more groups that are going to be able to vaccinate. You know, just having the event center is not going to be able to do it. We have to have our facility, excuse me, we have to have the pharmacies involved. We have to have private providers involved also. So that's what's going to be involved. This is going to be a very, very, very large undertaking, and it's going to be very complex. And I'm just going to finish here, and then I'll see if there's any questions or if Craig wants to add anything. There are a number of things that we don't know. And when I say that, I think people sometimes think that we're trying to hide things when we say, well, we don't know, but we're not. For example, we do not know when we're going to get more vaccine from the state. And I'm not sure the state knows when they're going to be able to do that. So this is really depending on how soon state starts getting increased numbers. There are a lot of things, rumors and talk that we've heard about. Yes, they're going to increase production and we're going to get more, but I can't tell you when. When are other providers like our pharmacies and physicians' offices, et cetera, when are they going to be able to start vaccinating? Again, I don't know those. We don't know that number. The pharmacies are probably it looks like, are going to be getting their vaccine through the federal government directly. So we may not even be involved essentially with that. And then finally, you know, the question everybody always asks is, when am I going to get my vaccine? And I wish I could tell you, but we don't know exactly. We can give you a ballpark. We can tell you, you're going to get it in phase 2, and we're going to try to get those things done as fast as we can. But I can't tell you a date, or I can't tell somebody a date on when they're going to get their vaccine. So that's kind of the situation right now. I think that we're in Shawnee County with vaccines. Craig, you want to add anything?
Just a couple of things that I did want to add. So as Dr. Cooley had mentioned, we have the ability in phase 2 to do a sub-prioritization. So he mentioned that we would be looking at that 65 and older population, law enforcement, first responders, which we are vaccinating in our clinics that are ongoing yesterday and today. And then also looking at our K through 12 to move into them shortly, as well as congregate settings. So if our forecasted models look at that grouping there first, looks at potentially around 40,000 individuals. At our current allocations that we are receiving, which is that 1950, even if we just round it up to 2,000, we're looking at 20 weeks to to administer just the first dose. If we look at the vaccine administering the first and the second doses, and understanding that the Pfizer vaccine allows for a 3-week period to start administering that, now we're looking at close to 43 weeks to administer all doses of vaccine to that priority population if we do not see vaccine allocations increase. So I just wanted to make sure I pushed that number out in an effort of being transparent, but also to again, as Dr. Cooley mentioned, to ask for just a level of patience from our community and understanding that this process is going to take some time. Additionally on that, what we understand from our community partners who are administering vaccine, if we look at Stormont Vale Health, KU St. Francis, and the health department, we do have the capacity at our current levels to vaccinate roughly about 2,000 people a day. We just do not have the vaccine allotments to do that. So if, and really probably more so when, we do see vaccine increase in our community, we have the ability, we've been proactive in our planning tactics to be able to stand up and expedite, if you will, vaccine into the arms of that priority population that we are serving. So we, as Dr. Cooley mentioned again, I want to give them kudos to our partners that are on our vaccine collaborative that we are meeting with more than once a week to work through this process. And Dr. Cooley was correct. We're getting new information day to day, you know, and so our team has been working very diligently to then sift through all of that data and then update plans accordingly. I think the only other thing was to offer an additional clarification. As we move into phase 2, Dr. Cooley was correct. We will only be receiving the Pfizer vaccine at this point in time. That is our understanding. We will still receive the Moderna vaccine for those second boost doses. So anybody in our community that was vaccinated through a health department facility at Ag Hall and received a Moderna vaccine as part of the phase 1 allocation or phase 2, we are still anticipating getting that additional allocation for those phase or for those second doses from the state, but we will not be receiving any new allocations of Moderna for future phases at this point in time. Those are all anticipated to be Pfizer vaccine moving forward. So with that, I will turn it back over to Dr. Cooley if he has anything additional or to the questions from the board. Thank you.
Commissioner Rippon, I know you've got questions.
I do have a question. Will it be possible in the future to know how the pharmacies are doing as far as vaccinating the older population? Because that is really the vulnerable group I see out there, and I'd be interested to know how well that's going. And I take it they're getting a different vaccine because they wouldn't have the ability to freeze the drug that we're getting. I wouldn't think they would have those kind of facilities, so they must be administering a different vaccination.
No, I actually, Commissioner, it's two good points. First off, we want to know how many of our long-term care facility people have been vaccinated, and we're working on trying to get that information. What we're having to do that, you have to kind of go through these are two big pharmacies, CVS and Walgreens. They are getting Pfizer, is my understanding, and I'm not sure where the refrigeration, the freezing that they have, how that has been working out. But that has been my understanding is that they have that capability, and they also have been using the Pfizer.
Good. Well, it's all right.
The only thing that I would add to that is the preliminary understanding is that some of the pharmacies or the two pharmacies, Walgreens and CVS, they're doing the long-term care facilities, will be tasked with transitioning into phase 2 once they complete the long-term care facilities that opt into that federal pharmacy partnership. And so any doses of vaccine that they receive will then be transitioned to start vaccinating phase 2 folks. Our understanding also from KDHE is that additional local pharmacies will be coming on board sometime, hopefully in February, to begin vaccinating into phase 2. Those allocations that they would be receiving, we do not know what that vaccine will be at this point in time, but we do know that those allocations would be, or what our understanding at this current time, and I want to always say that as the caveat because things can always change, but our current understanding is that those will be coming directly from the federal government. And so those allotments will not impact the states or any of the other counties in Kansas, those allotments that we are currently receiving.
I might add to Commissioner Rippon that there were some residents in long-term care facilities and also in the independent living who kind of were not being covered by that. And we have reached out and we are providing vaccine to them. So we've also been trying to pick up on any of our long-term care facility residents who've kind of fallen through the cracks so that we can cover them. Because you're right, they're the high risk.
Okay, thank you. Thank you for all your work on this. I know it's not what you signed up for.
Questions regarding the vaccine?
Yeah, I guess sort of in the same line as what Commissioner Rippon asked. He was mentioning CVS and Walgreens. I had a friend of the family that mentioned to me that they were able to get vaccination at the VA hospital. And so I'm curious if we have any idea how many vaccines they're administering, and are they, communicating with us? And then my second question is also, and I know the answer to this, but I'm sure that a lot of people don't, is, if we're only getting the Pfizer vaccine right now, what's happening to the Moderna? Where is that going? And do we anticipate that we'll start being able to administer that again in the future?
Yeah, a couple of things. As far as the Moderna vaccine, that is going to the other areas in the state. The 5 largest counties in the state are getting the Pfizer vaccine. That's how the states, for the new doses for the phase 2, that's how they're allocating. The rest of the counties in the state are getting the Moderna, and that has to do with the refrigeration, I think, more than anything else. As far as the VA goes, yes, the VA has been in contact with us, and we've had information from them on how they've been giving, how much vaccine they've been giving. They get their vaccine directly from the federal government too, and so they have been able to adjust their movement as far as going from phase 1 to phase 2 a little bit different than we have. And I know they have been giving, I think, at least to their 75-year-old population, they've been able to start giving vaccines to them too. Craig, anything else you want to add or correct on?
Yeah, no, I think Dr. Cooley had everything correct there. The only thing I would add to the VA is they've set up a similar risk stratification table. They started with their priorities within the veteran population here in Shawnee County at 85 and older, moved into the 75 and older population. And I think they'll be moving, if not already, to the 65 and older population sometime soon. So they have given over, the numbers that we include, they've given over 3,000 vaccines to their population. I don't have an exact number for you at this point in time, but we're working to try to get an update on what that number may be.
I didn't have an expectation that you had exact numbers for them, so I appreciate the 3,000 number. Is that taken into account in the total aggregate number that you've given earlier, the 19,000,
yes.
I believe it was?
And we'll keep that on the lower end there. That's why when Dr. Cooley mentioned it, it's the close to the 19,000, just because we don't have the specifics of what the VA has done, because they're not a part of the state's allocation.
Okay, and then I also had a question about the signups. I'm sure the other commissioners are getting, emails and phone calls about this as well. But obviously, we have the survey that we put out a couple weeks ago. I know that it seems that there are more and more lists growing on a daily basis from different provider networks and and even Walgreens, from what I understand, now has their own sign up. So is there going to be some sort of a centralized location that people can go to ensure that they're going to be on, I guess, our list, or do they need to sign up for every list they can find? And then also there was talk recently that the FEMA was going to get involved in vaccine administration. Has that happened? Are they doing anything with this as well?
So I can start us off with that. So the interest survey that we put out is really intended to be that. It is an interest survey to get an idea of the number of our population that is eligible to receive vaccine in phase 2 to express their interest. The health department, what we did was to prioritize first those law enforcement and first responders with the vaccine that we had, and we'll begin rotating, going through that interest survey for the people on a first come, first serve basis for those who are in the 65 and older population. And so when they filled out the survey, once we have additional allocations and doses that we are able to administer as a health department, we will begin reaching out to those folks who have completed that survey. Knowing the numbers that we gave you earlier in the time frame, it's hard for us to put out an email and says, you may be on week 36 if our allocations don't increase. I don't know that serves anybody any good at this point in time, other than, it may let them know that they received. But everyone who has completed the interest survey should have received a confirmation response when they completed the survey. We are aware that other entities have started creating those lists. I think that I would encourage the public at this point in time, if you're able to receive the vaccine, to receive it in whatever capacity from whatever provider that you can. We have received a large number of individuals who have contacted our COVID vaccine email address to let us know to take them off our list because they were able to receive a vaccine through another entity because they met that risk stratification level, say, for example, that Stormont was using within their organization to target that initial 75 plus grouping for that risk stratification, where they're now looking at the 73 and older population. So I would encourage anybody to take advantage of any opportunity to receive the vaccine. And that goes to say, once those pharmacies and any other providers that may receive vaccine come on board, at this point in time, we are aware of roughly 10 providers that are enrolled in the CDC's provider or pharmacy to receive and administer vaccine. So that's not a lot here in our community. And at this point in time, we don't know when those entities will be receiving direct allocations or if the expectation is that they would be receiving redistributions from the health department's allotments. And just to add kind of a caveat piece to that specifically is at this point in time, the health departments, and I know Dr. Norman mentioned this specifically in the press conference yesterday, across Kansas, the health departments are now receiving the allotments for the counties for the vaccine. And so that 1,950 doses that's coming to the county are coming to the health department, and we're working with our hospitals to ensure that they, especially Stormont, who has the increased capacity to administer more vaccine quickly and to a larger footprint, is receiving vaccine to administer to those folks. Dr. Cooley, anything you'd add?
No, I think that covered it.
Did that answer all your questions, Commissioner Mace?
Okay. Doctor, the distribution of the vaccine, I know that we've fielded a couple of questions wanting to know specifically wait times, how to get through the lines, how to be, and I don't know if you are looking at that, any concerns that you have with people that are showing up and progressing slowly through the lines and making sure they're not exposed to the cold, or as you know, we're dealing with a phase 2, very vulnerable population standing out in the cold for hours. waiting to get their shot. What are we doing about that?
Yeah, I think we're looking into that situation or situations to make sure that doesn't happen. We've seen it numerous places in the country, not necessarily here as much, but certainly in the country. I've seen, these pictures of our elderly folks waiting in lines for hours. The couple of things we've tried to do. First off is if you can schedule people and they actually follow the scheduling, that helps, because I think sometimes what happens is people have a scheduled time and they show up early thinking that that's because some people will do that. And of course, then it stacks it up. I think we're looking at the event center and certainly seeing how we can address some of those issues. I think as far as with the ag hall, I think we've not had much problem with that, but we've looked at that. We can try to decide how we can do that. A lot of it has to do with patient flow. Once they're inside these facilities, the distance that has been set up, I think, is excellent. It provides spacing. And I know certainly in our ag center or in the ag hall, we've been able to meet people through pretty frequently at a very good time. And most of the responses that at least I've seen from individuals who have gone to the ag hall have said that it's been a very, very good experience. But we're looking at it. We're trying to decide how we can improve anything if we can. And I think that overall, I think we've done a pretty good job of that.
Kellen, I see you're here.
Yeah, good morning or good afternoon, commissioners. Kellen Seitz, Spectra Venue Management in the Stormont Vale Event Center. I just wanted to touch on that a little bit. As Dr. Cooley and Craig have both spoken about the monumental effort of vaccine allocation and distribution, a lot of our focus has been on the operational and logistical pieces of actually getting the vaccine into people's arms in a safe and efficient manner. On Monday, with the start of Stormont Vale's entering into phase 2 at Exhibition Hall, we did experience some unforeseen challenges. The high demand and the sheer amount of people that were getting vaccinated on those days sometimes were upwards into the high hundreds or into the even surpassing 1,000 people. What we have deployed in our coordinated efforts with the hospital have been areas and ways to make that transportation of those folks, especially from the parking lot to the entrance of those facilities, a little bit more comfortable. Things like shuttle buses that have wheelchair accessibility to get them up to the entrance of those facilities, since a lot of that demographic and a lot of the population that's being vaccinated right now do have those mobility issues. Other things that we are currently working on are we entered into yesterday a rental agreement with a company to get covered canopy structures from those shuttle drop-off locations in the event that the surge in a certain time expands the population that is waiting to get their vaccine outside of the physical facility. In addition to those canopies, things like heating towers to keep them warm and comfortable during inclement periods of weather. We restructured a lot of the interior atrium area of the facility to try and meet as many people inside of the facility as they're waiting to get that vaccine as possible. As you can certainly assume, that's challenging, keeping all of the COVID precautions in place with mask wearing and social distancing. So it's an ongoing effort. We're actively looking every single day as new challenges arise and as more people are getting vaccinated in our community, at ways to make that more efficient, more comfortable for them, and certainly a better process for them moving forward.
Thank you, Kellen. Teresa, I think we're on to our next item unless we have any other discussion regarding vaccines.
as you all have heard just now, it is a large undertaking, and it's just continuous wheels in motion for the community. So hopefully that was good information for everyone to hear. We are going to do just a brief overview of flu surveillance and kind of where it's at in our community right now. And Dr. Cooley is going to do that yet again, and then we'll give him a break.
You guys are tired of hearing from me. Craig, can you show the slide that we had? Okay, here's a slide that'll show you, I think, what we're seeing with influenza this year and compared to the 2019-2020 year. The green line that you see there is what was essentially last year. And as usual with flu, in most years, you see that it starts rising in Shawnee County sometime here in usually in December, and usually will peak somewhere around February and then tapers off. So that's usually our strong season. And I can tell you from my years of practice, 40 years of practice with pediatrics, that that really, we would see this every year, that we would see the big peaks starting in January and in February, and then kind of slowly taper off. If you look at the blue line, that is us this year. And you can see it's pretty significantly down. We're not seeing a lot of influenza activity. I think we're seeing just as many tests being done for influenza. It's not that we're not looking for it. I think we are looking for it. You're also it's been monitored with the type of in our outpatient emergency departments, et cetera. And so what you're seeing is that we don't see a whole lot of activity right now with flu. And that's not only just in Shawnee County. The yellow line that you see there is also the state of Kansas, and you're seeing it. I can tell you that this was kind of expected, to be honest. Usually the flu season follows what's been going on in the Southern Hemisphere with us. And so when we looked at Australia this year, their flu season was much lower. And so we kind of thought that this might be the case. And with COVID, I think it's just been very, very helpful that the fact is that we're not fighting flu on top of that. So overall, I would say that our flu capacity right now, we're not seeing a lot of flu, and I don't anticipate that we will. Questions?
Any questions for Dr. Cooley regarding the flu? Okay.
I think we've had more flu vaccine too. I'm getting it. I just want to throw that in. And so if you haven't, please get it. It's still important.
Good. Thank you. Teresa, our next item.
Absolutely. Some good news from the flu update there. So again, I'm Teresa Fisher, the interim director with the health department. I'm just going to give a brief overview of our WIC program, which is our Women, Infant, and Children program, and really kind of how it's functioned during the pandemic. This is a program that did not shut down at all during the pandemic. Instead, we really haven't missed a beat in serving our participants. So just as a general reminder, our WIC program serves pregnant women, serves postpartum women for 6 months. It serves breastfeeding women up to a year. And then we serve children from birth to 5 years. So here in Shawnee County, we do what's called next day scheduling. We're one of just a few counties here in the state that does that. And so I have to put a plug in. Our number is 251-5607 for anyone who might be interested in learning if they are eligible for the WIC program, or if they know they're eligible, maybe they haven't had benefits for a while. For the most part, we stay up to date with our schedules. If you call today, you're probably going to get an appointment within the next day or two, usually during the holiday time, or if we have illnesses when we see a delay in the scheduling. But I pulled a few numbers from the pandemic that I thought were interesting. So April 4th, which would have been just the start of the pandemic, we had right around 4,100 participants enrolled. And of those, we had about 3,100 participating, meaning they were active, they were getting their benefits and using them on a regular basis. If you fast forward until the end of the year, to be exact, on December 4th, we had right at 4,000 enrolled and about 3,000 of those participating. So I think this is a testament to the work of the staff in the WIC program, that we've been able to keep steady caseloads. We've been able to meet the demand of this program, and that it hasn't seen a decrease in being able to serve during the pandemic. You might wonder, how does WIC really work during a pandemic? Well, when we sent staff home in March, that question wasn't really answered for us at the local, state, or national level. And so it's been a process that we've fine-tuned over the months, but one that really we've been able to handle very well. So on any given day, we have one clerical and one professional staff member here at the WIC office handling duties that really can't be handled at home. And then at home, we have 3 clerical staff members and 6 professionals that are working to serve our participants. So the actual process is a participant would call in for their appointment, get it scheduled. The clerical staff member then calls the participant and does what we call their intake. The participants are able to email their proofs in, things that we would normally require in person. They complete that part of the appointment. They then notify the professional who the participants schedule that they're on for the day, and the professional calls the client and does the appointment with them over the phone, does the certification, and gets their benefits issued to them. Now, of course, during this time, some key components of WIC are not taking place, such as we're not doing our heights, our weights, and our hemoglobins. We're still able to do nutrition education and counseling, though, which are just as equally important components of WIC during this time. At the end then is when they get their eWIC cards. Here in Shawnee County, we have basically, it looks like a debit card. And so we have a couple of options for participants that would need either a new WIC card or eWIC card, meaning they are a new participant to the program, or if they had lost theirs. We will mail that out to them so they can get that in the mail, or if they are needing it sooner or don't want to wait for that mail service, we offer a curbside pickup starting around 4 o'clock each afternoon. Participants literally pull in here to the JP Lewis building. A staff member who's masked up walks out and delivers them their card, and business is done for them, and they're on their way with their WIC benefits. Part of how this came about is the USDA is who governs WIC at the federal level. And in March 23rd to be exact, they waived the physical presence requirement for WIC. So that allowed us to be able to complete these appointments without the participant actually being on site and in the office to do those. The first waiver ended in May. Then we went on a month-to-month basis. So we went through June, and then we went through July. During each of those months, we started doing preliminary planning in the event that we were going to need to bring participants and staff members back here to the office. That ended up not happening. Eventually, the waiver happened to get 2 months, and so that put us out till the end of September. We went ahead and made modifications to the area here. So we now have an enclosed glass area for our WIC clerical that will sit in. That's permanent, and the staff report really liking it. But at that time, at the end of September, the federal government decided to not put a date on that. And instead, it's written that this waiver will not expire until 30 days after the expiration of the public health emergency. And so that public health emergency, as we know, was just reinstated January 21st. So right now, those are good for 90 days. So we are looking internally here that we would not be bringing participants back until about mid-May. That's with the understanding, though, that public health emergency can be renewed should it expire in April. So our total families that we have served, I did pull these numbers just so you can know. We've served just over 7,500 families in a period from April through December is the numbers I pulled. So as I mentioned, we've really been able to keep up with it and handle it. It's definitely been some unconventional ways of doing business in the WIC program, but I couldn't be prouder of the staff that has been doing this. I also want to mention our clerical staff. We also track calls, and we didn't start tracking calls for them until about July, but from July through December, our clerical staff has fielded over 9,500 calls from participants. So again, a huge shout out to the WIC staff here. They've done a phenomenal job in being able to handle the WIC participants and keeping this program just going on and making sure those that are eligible are receiving the benefits that they should. With that, I'm happy to answer any questions you might have.
Teresa, thank you for all the work that you guys are doing and continuing to do. Any questions for Teresa regarding women, infant, children, WIC programs? Okay.
No questions from me.
All right.
But thank you.
You're welcome.
Thank you for your work.
Thank you, commissioners. Our last agenda item today is we're going to give just a brief update on the community health needs assessment that is getting ready to get started again. And Craig is going to give us that update.
Yeah. Good afternoon, commissioners. I think I'm our last presenter, and then you guys can go back to not having to deal with us from the health department for a little bit. So this is an exciting update for me. I think this is the health needs assessment and the subsequent community health improvement planning processes have always been a passion of mine here for our community to ensure that we are getting representative data from our community members to then develop targeted goals, outcomes, and strategies, as well as interventions for our community to improve the health and wellness of our entire community. So throughout the entire pandemic, the planning process for the community health needs assessment has still been ongoing. The planning partners include Stormont Vale Health, Heartland Healthy Neighborhoods, which is our community health coalition here, as well as the health department. We will have other community partners, a large contingent of them across our community that will be coming on board to help us execute the surveys and other pieces during the needs assessment. Just as kind of a refresher, the community health needs assessment is done every 3 years. It is a requirement of nonprofit hospitals and a requirement of the health department's accreditation process. But like I mentioned, the real reason we do this, and even before we had looked at the accreditation for our community, was to gather that meaningful and actionable items or information directly from our community and our constituents here as to what their specific health needs are so that we can develop those interventions. So as a whole, I mean, this assessment is really gives us a good snapshot of the entire health of Shawnee County. So as we start into February, surveys themselves will go live February 1st. So we would encourage the public to take part in that. There will be both surveys available through a multiple means. SurveyMonkey QR codes will be out. There'll be some advertisement. Paper copies will be distributed through community partners across the community. And that'll happen throughout the month of February. We will have both the links to the English and the Spanish survey available as well on the Shawnee County Health Department webpage. They will be on the Stormont Vale Health webpage. And I'm sure as more entities post those, we will get that information out as well. Of course, they'll all be shared as well through our social media outlets. During that same survey process, the planning team is hosting roundtables. These are discussions with targeted groups that were underrepresented in our last assessments, and to ensure that we get a wide variety of feedback from our community at large. And so those roundtables are ongoing now and will last through the month of February as well. Then second to that, so that'll be a kind of our primary data collection process, if you will. There'll be some secondary and tertiary data that is collected as well to ultimately compile the whole final report for the needs assessment. And that'll include specific county demographic information as we normally include, but also information for the county health rankings. And then in April, the plan is, as we typically do and have done in the past with the needs assessment, but is to host a town hall and invite key stakeholders from across our community to review the information that's been gathered and help us then determine some priority areas of need. So we did publish our last community health needs or community health improvement plan in 2019. Those also run on 3-year cycles. So that has been published. Heartland Healthy Neighborhoods work groups have been working on those intervention strategies as well as other community partners. And that's will work through 2022. But then the community health improvement planning process really will start in earnest following the completion and publication of the needs assessment. So with that, that's just kind of the brief overview. I think we'd like to come back and kind of give you an overview at some time at a county commission meeting as kind of the process is going through in February. But with that, I'd be happy to answer any questions that you may have about that process.
Any questions for Craig?
All right.
Okay. Thank you, Craig.
Thank you.
Commissioners, I did receive a note from Jim Crowell. Jim, there you are.
Good afternoon, Jim Crowell, Shawnee County Counselor. Yeah, as been our practice, I feel like a pest when I do this, but I guess that's part of my job to be a pest sometimes. I recommend that we, my recommendation for a couple of reasons would be that we adopt a resolution approving or amending whatever your decision may be, the health order that was issued today.
And why should we do that?
It would protect us on certain specific legal arguments that have been raised in litigation across the state and the country involving the issuance of health orders. It would also aid in our enforcement actions in the event there is a need for a shutdown order or enforcement action.
At this time, is there a motion made?
I think we need to talk maybe a little bit more about some of this stuff. When we put that initial order in back in November prior to Thanksgiving, our cases were on a rocket ship trajectory in exponential growth, and our hospitals were overrun and turning waiting areas into medical rooms. We, in that meeting, discussed mobile morgues being brought in to our local hospitals because we had such a large death toll. A lot has changed since then, and I am not sure that some of these measures are as necessary now as they were then. And so I'm curious to hear the thoughts of the other two commissioners on this. Before making any kind of a motion, I'd like to at least have a little bit more discussion.
Commissioner Mays, like you, I share many of those concerns with, and I've expressed this privately with Dr. Cooley and with Dusty Nichols as well, is when we have issues, we are very quick to implement restrictions, but when we have progress, we seem to be very reluctant to lift any of those restrictions. And it's kind of, if this was a parent, there should be a reward punishment basis. When your child does well, you reward them. When they do badly, there's a consequence. And I know that we're very cautious. Dr. Cooley has expressed that we should be very cautious, that we are making good progress, but we're not out of the clear yet. But like you, I share many of those same concerns with, we seem to be very slow or reluctant to lift any of those restrictions. And especially where, I mean, I'm glad that we are looking at allowing some of those sporting events to occur, but specifically looking at the gathering size, the bars, restaurants, hours, regulations. what is the effect if we are closing at 10? Is it having an adverse impact by having house parties or other activities that are contrary to what we have as our intended result? I do not want to go for a month. I do not want to go for a month before we review. I think that is far too long. And whether or not we go for 2 weeks, and I understand that, Dr. Locke needs time to come up to speed, but I think that as the Board of Health, we also need to be responsive to what's going on in the community. Commissioner Rippon.
Yeah, I agree with that. I think, I appreciate everything the board of, or our health department does, and Dr. Cooley. But I think sometimes as commissioners, we have to look at things with a broader lens. And, they're concerned about the virus and controlling it. But we also have other issues in the county that, businesses that are hurting. And, is another hour in a bar going to really make a difference? Or a restaurant, or, how many kids are in a sporting event? I don't know. But I just think we need to be flexible and be able to kind of bounce with the tide here. So I too would hate to wait a month. I would like to keep reviewing this. We're in a pandemic, so we have to. It's not like a monthly meeting. We need to be able to move quickly. So,
Dr. Cooley, I see you're back. Thoughts, comments,
I've been here.
contributions?
Well, I think that certainly an option would be for you to take a 2 week to keep the health order as it is for 2 weeks and reevaluate it. You're going to get, again, that'll be after the Super Bowl. You'll get, I think, a better idea of, are you continuing to trend down? You may find out in 2 weeks that you're into the out of the red zone. And so I think that certainly would be an option that you might want to consider.
Commissioner Mays?
I think that before we do that, I think we need to look at, what do we see as the most impactful of the measures in this? Dr. Cooley, what is, in your opinion, what is the absolute most important piece of this that we should not touch? If we were to make changes today, what is the one thing that you think is absolutely essential to the effectiveness of this order?
I think you have to, mass gathering, I think, is the most important thing that you can do right now. And I think because that is, I think that's going to tell people, that give them an idea that no, getting in large groups is not the way to do it. And so I think if that is the most important, is the mass gathering. And I think that especially with things coming on, if you increase mass gathering, what that's going to do is that's just going to open it up even more. So I think that's the prime thing. I still think that having those bars closed at till 10, I think is just right behind it. And I think that, but I do think that gathering is probably the most important thing.
Commissioner Rippon, any questions for Dr. Cooley?
I can't think of any right now. I'll have them as soon as I leave this meeting, I'm sure. But yeah, I don't know. I've seen statistics both ways on a lot of this. There was one on KDHE's website that showed where transmission rates were, and actually bar and restaurants weren't all that bad. It was mainly from homes and long-term care facilities. School events, not very high. Sports, not very high. I don't know. It's.
I think, again, I want to go back to the thing. I think you got to understand that the bars right now and restaurants with a lot of places are under restrictions. And so I would expect them to be low. I would expect that we don't see a lot of clusters right now in Shawnee County in our bars because we're keeping them closed at 10 o'clock.
Have we seen any clusters in the communities where they have opened up, like Wyandotte County or?
Yeah, I think, as I said earlier, I have not seen any data that shows it one way or the other with those counties. I don't
And
know.
I'm not sure what some of the other counties around here are doing, Riley County or Sedgwick County and places like that. I don't know. I just don't even know.
Commissioner Mays?
Yeah, I think it's also important to note that the hours are not the only restrictions that we have imposed on restaurants and bars. There are also many restrictions in terms of capacity and seating, and things like that we need to be aware of as well. So for me, I mean, when I look at those things, I think that probably that the seating capacity is equally, if not more important than the hours of operation. I don't know, perhaps somebody else has a different opinion on that, but I think that that's something we need to, at some point, we'll need to start talking about that as well.
Dr. Locke.
I just wanted to share along that line, Commissioner Mays, the last time I reviewed the Johnson County and Wyandotte restrictions on bars and restaurants, although they did open until midnight, they did restrict the group size at each table to 8 people, and we currently have that at 10.
I think that's a fair trade-off. I mean, what do you guys think? Would something like that make sense?
Commissioner Rippon.
Let me get this straight. We allow 10 people at a table, and they just restrict it to 8. How often do you have a table with 10 people around it, though? I mean, as compared to 6 or 4, I still think you lose a lot of business in restricting, or I don't know if number of people at a table makes that much difference. I don't know. I would think they'd rather have another hour than a table restriction.
Dusty Nichols.
Just to clarify, the mass gathering is groups no larger than 10 up to 100 or 50% of the capacity, so forth. So what they're referring to on the table is their max capacity is groups up to 8, it sounds like, versus our groups up to 10. So it's not necessarily have to have 8 at a table specifically. It's the clarification of that. So it's no groups no larger than 10 at a table or anywhere.
So Commissioner Rippon, you would have to find 9 friends.
Yeah, I just have trouble getting my head wrapped around the 10 o'clock. Why 10? Why not 11? Is it really that much more dangerous if you go an extra hour? I know some of these bars and restaurants have told me that their earnings were down, like when we restricted it down to, I know at 9 o'clock, when some of them were 40 to 60%, they lost revenue. And it's not just that, it's people that work there, their hours are cut in half because they don't need them as often and they don't need as many. And it's tough. It's tough for these people. So,
Dr. Cooley, a question for you. And again, just as we're having this discussion, currently we have hours of sale of alcohol. And I believe the hours is still at 11 o'clock when liquor stores would stop selling alcohol. If we have a bar or restaurant that closes at 10, that allows an hour of opportunity to go to buy alcohol from a liquor store or grocery store or convenience store presently. If you have a bar that closes at 11, that closes that window that you would not be able to leave at 11 and immediately go and buy to continue your party elsewhere. You would have to plan ahead. Does that, again, if we're trying to limit people gathering and engaging in risky or reckless behavior?
I think you're kind of talking a little bit of some apples and oranges to a certain degree. So in bars and restaurants, not only, they try to limit you to the group that you're with, but the truth is that you have a lot of other people who you normally aren't with. odds are you're not going to invite that whole group to your home. If you go home and you stop at the liquor store and get liquor people go to bars, not necessarily for the liquor, quite frankly, because they can get that much cheaper at a liquor store. They go there for the social interaction. And so really what you're doing is you're decreasing that. And to say that, well, everybody that goes home, that when a bar closes at 10, that everybody is going to end up going home and have a party at home, I think is wrong. I don't think you can say that that's going to happen. I'm not saying it wouldn't happen occasionally, but I'm not sure that you could say that that always happens, or that the vast majority of the time that's going to happen. So I kind of don't think that fits.
Yeah, I somewhat agree with that. I think it's a different crowd at 10 o'clock. But they're a younger crowd. They come out at 10 o'clock. They're probably just going directly to a liquor store than someone's house. Probably what they're doing. I think the crowd you have in a bar up to 10 o'clock is different. I think it's just a different age group and everything. But
I think it's a lot of speculation. I don't have data that could say.
I don't either.
And so, we're trying to speculate some things. What we do know, we know that bars and restaurants, by the data, they do have higher transmission rates. And so, and again, part of that may have to do with the fact that it's not the group that you're with, it's the group that are around you too. And even though you try to distance and you don't have your masks on all the time, there is some, we know that there's probably aerosolization and some spread. Bars can try to do, and they can do everything right. I think this has been pointed out. They can really work, and just like earlier today when that discussion was, they can do everything right and you can still get a significant amount of spread there. It's just from the bars and restaurants.
From the data I've seen, yeah, you have some little spikes for different venues, but it's the nursing home facilities and long care facilities. That's where it's an enormous spike compared to everything else. And that's the area I think that most of the emphasis needs to be put on. The restrictions or guidelines or vaccinations, everything. I think that has to be your main focus, and that they're your highest death rate. I don't know. I just hate to keep our thumb on these businesses forever, when I think the real problem is the people who are the most vulnerable, the ones who have medical conditions and the elderly.
And rip on. And I think in the past, though, the concern has been the staff members of the nursing facilities or the vulnerable population, that if the staff members are going out to the bars, or if the staff members are going to house parties, that they become infected and then they bring it into the nursing facilities, which causes the greater infection.
You're exactly right. But maybe that's where more restrictions from the long care housing facilities or nursing homes, they need to be more restrictive with their employees. Say, hey, we don't want you bringing things in here. You need to be tested more. You need to be in the line to get the vaccines. But that is the population that really needs to be protected. However you do that, they're the vulnerable ones. If you look at statistics on who has died from this, it's elderly and people with comorbidities. And not that can't happen in a bar, but there's a huge difference.
There still seems to be a bit of randomization to the impacted, as we are still learning more about the virus, though.
Oh, I know.
Commissioner Mays, going back to the discussion and keeping us on task, do you have thoughts regarding the current restrictions or health order, rather? Again, looking at our hour, I think really what we're down to is we're discussing bars and restaurants, gathering sizes for bars and restaurants at tables.
Well, keeping in mind that, Dr. Cooley said gatherings are the number one, concern. I think it's important that we just go ahead and keep the gathering sizes the same. Dr. Locke mentioned, those other orders, maybe limiting the number of people allowed to sit at the same table in a restaurant to 8. I guess that's a possibility, but I think that if we do that, I think that we probably ought to do a give and take and extend the hours of operation. And then I also think that if we're going to do anything, I think a month is a long time for us to, sit here when so much can change. I mean, as we've seen, things change overnight. It seems like. So, I mean, we've traditionally done 2-week cycles on everything. I think that would probably be an appropriate length of time to extend the order for. I think it's just a matter of the details. And so I think if we were to extend the hours, I don't know. I mean, you mentioned 11 o'clock. We could do 11 o'clock. I know that there are people that would prefer we do 2 a.m. again. I don't see that happening. So, I mean, I feel like we've got to do something. As Commissioner Cook, as you said earlier, there has to be sort of a punishment versus reward, I guess you could say, in terms of giving something back to reward people for the sacrifices they've made at this point. And so I don't know, maybe we do 11 o'clock how about, should we make a motion and then do amendments one by one in terms of different items?
Well, are we really looking at, we're only looking at that one section then, the rest of the health order remains untouched or not really. I don't know that we've had any discussion is there any inclination to change any other part of the health order other than as it relates to bars and restaurants?
I don't have anything at this time.
Well, I think the only other piece would be the expiration date or renewal date, or maybe, I mean, if we did it for a month and then just sort of as an aside, planned on readdressing it in a week or two, and
well, a new order can come out too in a couple of weeks. So
I would prefer that we have this set to expire in 2 weeks, and then we would come back. That way, Dr. Locke, I mean, it's clear for Dr. That she's working up the plan. And there we are. And I know that again, it's going to take a moment for you to come up to speed, and we anticipate that. But having this being reviewed on a 2-week basis as opposed to a month-long basis, again, being more responsive to what is going on in the community and knowing that it takes a moment, whatever we do has impacts that take a moment to be realized.
So I think I don't know, I guess as chairman, why don't you tell us how you want to proceed?
Well, I hear what you're saying, Commissioner Mays, is a motion to amend the bar hour from 10 o'clock to 11 o'clock, but restrict the seating at within the bar to 8, so that it would be consistent with what we have seen in Wyandotte County. That's what I thought I had heard earlier from your discussion as that give and take.
Yeah. So moved.
I'll second that.
Okay. All other parts of the health order would then remain as presented without any change or amendment?
Does the expiration date, for lack of a better term, is it at 2 weeks then, or does it have one?
Then 2 weeks, Jim, puts us at, sorry, pulling up my calendar as quickly as I can. Puts us at February the 11th. Is that correct?
Okay.
That sounds correct.
And does our current health order, it expires tomorrow. So it would be February 12th that the health order would expire as opposed, and then we would review on February the 11th.
And then Jim, you would want a resolution reflecting all this?
Yes, based upon your motions today, which you still need to vote on.
Yeah, we're getting there.
Yeah, just a reminder, I would then draft those changes into a resolution and circulate it along with the new health order.
And so Commissioner Mays, would you accept that the health order would expire on February the 12th to be reviewed by the Board of Health on February the 11th?
Yeah.
So there is a motion to amend the health order as presented from the Shawnee County Health Officer to amend the bar and restaurant hours from 10 o'clock to 11 o'clock, but decrease seating from 10 to 8 persons, and that this health order would expire on February the 12th, but should be reviewed by the Shawnee County Board of Health on February the 11th, 2021. Motion made by Commissioner Mays.
Second.
Seconded by Commissioner Rippon. Our roll call vote, since I'll just go through. Commissioner Cook votes yes. Commissioner Mays?
Yes.
Commissioner Rippon?
Yes.
All right. Jim, is that clear enough for the record? Got a thumbs up. And again, I do want to stress that this is not something that we do carelessly or with frivolity, but it is done looking at trying to balance out that public health and public policy, and there is quite a bit of friction there. And so making sure that we can keep the community within our health orders and looking at the overall safety of our community. And Dr. Locke, any thoughts or comments before we conclude?
Nothing additional. I'm looking forward to working with everyone.
All right, thank you. Is there any other items to come before us today? Seeing none, the Shawnee County Board of Health would be adjourned. Thank you.